please be advised that the meeting is being broadcast via internet. So also please turn off your phones, cell phones. Thank you. We are going to move to agenda item 2, is the consideration of approval of minutes from the June 21st, 2012 meeting of the Committee on Strategic Planning and Policy and the Committee on Closing the Gaps. I don't know if there are questions or any discussion or comments.
Move approval of both items.
Second.
Motion has been made and seconded. All those in favor, please say aye.
Aye.
Those opposed, same sign. Motion carries. Next agenda item is consideration of approval of the consent calendar for the Committee on Academic and Workforce Success meeting. I'm not sure if you all have the consent calendar. Any board member can add items or delete the items from the consent calendar. Do you all have the? If there are no comments, no questions.
Move approval of the consent calendar.
Mr. Chairman.
Motion has been made and seconded. All in favor, please say aye.
Aye.
All opposed, same sign. Motion carries. Next, agenda item 4 is consideration of public testimony on items relating to Committee on Academic and Workforce Success. I don't know if we have anybody registered, so we don't have anybody registered, so we can move on to the next agenda item. Agenda item 5 is matters relating to Committee on Academic and Workforce Success. This is consideration of adopting staff recommendation to the committee relating to a request from Texas A&M Commerce for a Bachelor's of Science in Nursing BSN degree with major in nursing. I don't know if there will be a presentation made.
No, sir.
So McGregor will make a presentation.
Thank you very much.
As you all know that there is an enormous shortage of nurses in the state of Texas. So this is a good thing.
Thank you, Dr. Agarwal. There are representatives from A&M Commerce. Dr. Dan Jones, the president, and members of the nursing faculty and administration are here as well if there are questions from the committee. This is an opportunity for a full BSN program that will be offered at the A&M Commerce campus specifically, and that will provide for opportunities for the 5-county region. The nearest other programs are at Texas Women's University and UT Arlington, and so those are the closest for the BSN program. From the institution's perspective, they have gotten the program to a 120-hour degree, which is below the statewide average for the number of hours required for the BSN, which we find very encouraging. And so for those reasons and the fact that we felt like the program had an opportunity to serve a specific region, we did recommend approval. We did ask that the institution provide us with annual reports on their ability to attract and retain sufficient faculty to support the program, as that has been one of the issues for starting new nursing programs around the state. And we want to make sure that they do have adequate faculty for the support of the program over the initial 5 years of the degree. And so that's the only caveat to our recommendation for approval.
Recommend approval.
There's a requirement, if I'm not mistaken, that there be a 10-to-1 ratio, faculty ratio between instructors and students. Is that correct?
It is for certain clinical courses, and if you'd like more specific information, I'm sure we can get some folks from Commerce to help you with specific questions.
I would like to know, number one, is that true?
Yes, sir,
If
it is.
Who mandates that?
The Board of Licensing, Board of Nursing, the licensure body.
Do they have that statutory authority to mandate that requirement on the nursing profession? Because that's pretty unique in healthcare to have a licensing agency dictate that ratio.
Did I say that correctly? I'm getting nods. So yes, they do, and they do have the authority to do that under their statute, as I understand it. I have not looked at those myself, but this has been a standard operating procedure that they have had in place for many years.
It is. I agree with that. But it's also handicapping, or at least making it more difficult, particularly for some of the smaller ADN programs, because these nursing programs are very expensive, and I question sometimes whether or not they could still educate qualified nurses without that requirement. So, I mean, I don't know who has that authority. I know that the State Board of Nursing Examiners are the ones that mandate that, but it's a little bit odd that they are the agency that has that authority. And I don't know whether that's through their rulemaking process or whether or not that's statutory completely.
Both. They have the statutory authority to recognize nursing programs in the state, and in order for students to be licensed, they have to come from a recognized program. And so that is part of the requirements that they place on the recognition of those programs.
Are there any other questions? Any comments?
So in follow-up to that, Dennis, maybe staff could research whether they truly have that statutory authority to do that, because essentially they're regulating higher education.
They are. That's
by doing that. So maybe at some point in the future we could have a report. I'm looking at Bill Franz to possibly assist in researching that.
Would you like us to do that for the MDs as well? Because, I mean, the medical board has similar requirements for medicine.
I'm not aware of that.
If they do, I'm not aware of that. But yeah, if they do, then I would like to know whether those state agencies have the statutory authority to regulate the faculty ratios in higher education.
I'm not, and I'm like David. I'm not an expert in that area, but David, I'm like you. I'm not aware of the state medical board having that authority to dictate the faculty to student ratios in medical schools. And they may have, but
I'm not sure either.
Yeah, and I think it's very unique, in my opinion, that the State Board of Nursing Examiners have that authority to dictate the educational requirements, and their legislative mandate is to protect the public and to ensure that we have good nurses out there practicing good nursing, not necessarily, in my opinion, to dictate what the faculty to student ratio is. That should be the responsibility of another agency, in my opinion. I'd like clarification on that.
Okay.
I'd like, if you don't mind.
No, sir.
And if the state medical board or a State Board of Medical Examiners or the industry or whatever else is doing that, then I'd like to know that also.
I think it's very common nationally for there to be clinical requirements for faculty.
Now, the clinical requirements, right? I understand that, but I'm talking about if you admit 100 students into an ADN program in a community college, that means you have to have 10 faculty members with a limit. They have to have a master's degree with 16 graduate hours in nursing. They have to have 10 master's degree nurses with 16 graduate hours in nursing to have 100 students in their program. And what I'm simply saying is, to teaching their core courses, I don't understand why they can't have 50 students in a classroom to teach gross anatomy and still having, I understand the clinical requirement, but I don't understand why you have to have that in terms of your academic instruction. I don't want to belabor this. I'd just like to simply drop it at this point and ask you to investigate it, if you don't mind.
Okay.
Approval item A1.
Second.
Motion has been made and seconded. If there are no other questions, all in favor, please say aye.
Aye.
Those opposed, same sign. Motion carries. Next agenda item 5A2 is consideration of adopting the staff recommendation to the committee relating to a request from the University of Texas at Austin for a Doctor of Philosophy degree with a major in African American Diaspora Studies. McGregor will present this item.
Thank you, Mr. Chairman. This item was a proposal from the University of Texas for the PhD in African and African Diaspora Studies. The staff did a preliminary review and the program approval review, and then had a site visit conducted by 3 national experts. And the bottom line of the site review was that this program was going to come on, when the program comes online, it was going to not only be nationally competitive, but was going to have opportunities to be the national standard. Because of the level of support that the institution is providing, and because of the quality of the faculty that have been attracted to the program. 3 of the faculty are here today, and I would like to point out that Dr. Kevin Lemoyne, who used to be here, is here representing the UT system today, even though we're still upset with him for leaving. And so we're not going to let UT System have any more degrees now that Kevin's over there. I didn't figure the board chair would mind. There might be some others that could object. But
I agree with
well, I feel bad for his having to take that step back in life.
But in any case, the African and African Diaspora Studies program is seen to be a great opportunity for the University of Texas and for the students that come there to receive an outstanding degree that's going to be competitive nationally with the other national programs. It is a fairly small field in terms of the number of openings that are available, but the external reviewers and the faculty here feel like that their students are going to be competitive from day one with the existing programs, and that it will be a benefit to the University of Texas community for having this program. And so we do recommend approval with the standard reporting required over the first 5 years.
Motion has been made. Second?
Second.
All in favor, please say aye.
Aye.
Those opposed, same sign. Motion carries.
Thank you all very much.
We can move to the next agenda item. 5A3 is consideration of adopting staff recommendation to the committee relating to the request of University of Texas at UT for a Doctor of Philosophy degree with a major in statistics.
Thank you, Mr. Chairman. And again, this item is one where the University of Texas has had statistics courses and programs at the bachelor's and master's level for a significant number of years. They have never sought the statistics at the doctoral level, and they did come forward with a very good proposal that requires the right range of courses and dissertation requirements, and we did feel like that they would come into the program and be competitive in that there are only 2 programs currently in the state, one at Texas A&M University with the PhD, and then UT San Antonio offers a PhD in applied statistics. And again, it's a fairly narrow field in terms of the academic program demands for new faculty, but in the larger sense, statisticians have a very broad appeal for employers in a variety of fields. So we felt like there would be sufficient demand for the students, and that the competitiveness of the students would be acceptable coming in as a new program with other existing programs nationally. And we do recommend approval.
Thank you,
We
Miguel.
have only 3 other programs of that type in the state.
There's actually, correct, there's 3 programs. Sorry, the University of Texas at Dallas is the 3rd. Yes, sir.
Move approval.
But now, just to be clear, the UT Dallas is consolidating their statistics program into mathematics, and there will not be any further statistics students there.
Motion has been made. Dr. Golden?
Second.
All in favor?
Aye.
Those opposed, same sign. Motion carries. We got next agenda item is 5A4.
Thank you, Mr.
Consideration
Chairman.
of adopting the staff recommendation to the committee relating to a request from the University of Texas at Dallas and the University of Texas at Arlington for a joint doctoral program with a degree major in mechanical engineering.
Thank you very much, Mr. Chairman. This is a program that we've worked very long and hard with the University of Texas at Dallas in developing what we believe is an outstanding example of the collaboration across institutions to develop a program that's going to be stronger together than either one is apart. The University of Texas at Dallas has some distinct expertise in their mechanical engineering faculty, as does the University of Texas at Arlington. And together, those two programs are going to be able to offer their joint students a much broader array of options in mechanical engineering than either would alone. And we felt like this was a much better program for developing it as a joint program than trying to develop it independently. And I really would like to commend the University of Texas at Arlington and the University of Texas at Dallas for the work that they have done on this. They really have committed a lot of resources and a lot of effort to this collaborative venture. And would like to put in a plug to other institutions that are considering some of these high-cost programs to look at partnering with other institutions that already have them and trying to find ways to maintain a high-quality program without duplicating it at every institution. And so we do recommend strongly the approval of this joint degree program, and again, appreciate the work that the institutions have done together on this.
Thank you. Dr. Tusher has some questions.
Are there representatives from both institutions?
Yes, sir, there are.
Would come forward? I had some questions I'd like to ask them.
Yes, sir. If you all step forward and take a hot seat. I don't know whether we need to ask Dr. Lemoyne to come as well, just so that I can ask him some questions.
Well, while they're doing that, can I ask you a question?
Yes,
the graduate of that program would receive a degree from one or the other, or both?
It would actually have two seals on it.
Okay.
One from Arlington and one from Dallas.
Okay.
And there are a few other examples of joint doctoral programs across the state, but not that many. And so it is a very great trail to blaze.
So good afternoon and thank you. So in regard to his remarks, I would like to say compliment you on developing a unique opportunity here. Can you give me a little bit of background on how you got to this point? Because certainly this is our challenge, is to try to make sure we're using the resources as best possible. And any lessons learned that we could pass on to other institutions that may be listening in and considering that?
So my name is Andrew Blanchard. I'm Vice President for Information Resources at the University of Texas at Dallas. I'm a faculty member in EE, and I teach in the mechanical engineering program. That's just to make sure that you know I'm an engineer and the questions that you ask. This is our second trip around the block, and that is with the bioengineering program, which is reasonably new in our particular university. The PhD and the MS degree are actually jointly administered and functioning between the University of Texas at Arlington, UT Southwestern, and UT Dallas. And one of our experiences in that particular program is how effective it's been. It's a strong program. It attracted more students than we could have sort of attracted independently. And the collaboration between the two institutions in concert with the medical institution has been really positive. Our mechanical engineering program is a strong one as well. Our BS and MS programs were the first ones that were put in place. 3 years old, 425 students at the MS and BS level. Strong interest. I teach the sophomore course in statics and dynamics. And the faculty and the students both recognized that there was a real desire to do some strong research in the area. What's interesting about our ME faculty that we've hired is they don't look like traditional mechanical engineers. Some of them operate in the optical world. Some of them operate in the nano world. Some of them operate in specific thermodynamics and heat transfer processes. So when we looked at the faculty at UT Dallas that we were attracting and the faculty at UT Arlington, we found that there was a much broader spread of expertise, skill sets, capability, research interest than we could have put in one institution. So our desire was really to try to capture that process. It worked well with the bioengineering program, and there's nothing to tell us that it wouldn't work well in the mechanical engineering program as well. That's one of the
Are there
reasons.
any logistical issues with two campuses?
There always are. You could be, 14 feet away, and there's always a logistical issue. But from our perspective, we connect to UT Arlington on a regular basis, just 30 miles away. Fast car and a good time of the day, and you can make it there pretty quickly. So from our perspective, it really hasn't hampered the interaction with the faculty. In a lot of cases, we'll have joint conferences and seminars that both faculty will attend. Students seem to be sort of independent of where the location is. They spend time on campus where they need to spend time on campus. We don't let that slide. We work hard to integrate the faculty. We make sure that they're focused agenda items that we can collaborate on and sort of connect the faculty in an appropriate fashion. So
is there options of say a live lecture being broadcast and actually heard at the second campus?
we can go both ways. We both have capability to do blended online learning processes. If the opportunity presents itself to sort of split the lecture, we'll team teach a course. So all that is a function of really the faculty interest, and they tend to take that to heart. And in some cases, rather innovative in the way they put a lecture together.
Any other comments from your two colleagues?
I would say that
Identify yourself, please.
Oh, yes, absolutely. I'm Kevin Lemoyne, Assistant Vice Chancellor for Academic Affairs at the UT System. And I just want to thank Dr. Stevenson, who encouraged UT Dallas and UT Arlington to work together several years ago, starting with the biomedical engineering program. It's fostered a lot of discussions, a lot of opportunities across the institutions, and we really think that it enables the institutions to do more than they would otherwise alone. Thank you.
Thank you, sir.
May I make
One
a
final
comment?
comment, if I could, Mr. Chairman. Serenity King is not sitting here because anything more than she knows exactly what this program looks like. She's worked very hard to help both faculty at both universities put the proper proposal together. And if you know Serenity, you realize that if it comes to you, it first comes to her, and she will put the quality of approval on before it hits your door. So that's one note of appreciation that I personally give, but certainly I think the board in the system recognize her contribution to this process.
This is, Mr. Chairman.
You had something?
I would just also like to add that we are also considering bringing additional joint programs between UT Arlington and UT Dallas, and we do appreciate the suggestion, and it has fostered a lot of collaboration on our campuses, and we appreciate that.
Can you name some of those programs that you are planning to bring together?
Yes, we actually right now we're in the discussion and planning stages for a joint PhD in geospatial geographical sciences. UT Dallas currently offers it, and UT Arlington does not.
Thank you. Dr. Golder.
Yeah, first of all, Dr. Stevenson, you obviously have done an excellent job in helping facilitate this collaborative effort. And I know y'all get tired of hearing me talk about arms race. This is a perfect example of what an arms race is not. And I want to commend the fact that I've seen situations where it's difficult to get faculty within the same institutions to collaborate, let alone faculties from separate institutions to collaborate and really do something better than what you could have done individually on your own. And this is the focus that I, for one, like to see, and probably a lot of the board members here, is us beginning to focus on the mission of higher education in the state of Texas, and not necessarily of what we can do as individual institutions, but what we can do collectively across the state by working together to push Texas to the forefront. Job well done. I am really, really impressed.
Thank you.
And Dr. Stevenson, you've obviously done a good job in facilitating this. I would like to nominate, if Dr. Mary Smith is here today, these people for a star award in the future, if they're not already lined up to get one. I'd sure like to see them be considered in the future, because this is certainly a model that other institutions could look to duplicate and replicate. Thank you, Mr. Chairman.
McGregor, is there an opportunity to use some lessons learned in this and publicize this among the higher education community to kind of spur some inspiration?
We do look at these kind of opportunities as new degree programs come in to try and find ways to take advantage of expertise at one institution rather than creating a second program. And I think the message that the board is giving today is a very clear message to the institutions here and those listening online, and one to be continued.
Yeah, I think it is important to add just very quickly that there are some other examples. This is so. There's some things that have gone on in San Antonio. In Houston, a Star Award actually was won by Rice, one of the medical schools, University of Houston. I think UTMB as well for cooperative efforts. Rice and Houston are sharing foreign language faculty where they don't offer a joint degree, but I just want to mention this, not to understate what you guys are doing, but there's a little bit more going on than we sometimes recognize, and we ought to. There's a lot of creativity going on at institutions that are more evident when actual proposals come together.
Any other questions?
Move approval.
Motion has been made.
Second.
Motion has been seconded. May I have all those in favor, please say aye.
Aye.
Those opposed, same sign. Motion carries.
Thank you all very much.
Next agenda item 5A5 is consideration of adopting a staff recommendation to the committee relating to the request from the University of Texas Health Science Center in San Antonio for a Doctor of Medical Physics, a DMP degree with major in medical physics. And McGregor will make a presentation.
Thank you, Mr. Chairman. I believe Dr. Jeffrey Clark from UT Health Science Center San Antonio is here. If you'd like to come on up, sir, I think we may have a couple questions for you. But this program is basically a recognition of the level of work that is required to become a licensed medical radiologist, medical physicist. The current program provides that you have to complete a Master of Science in medical physics, which is a 2-year degree, and complete 2 years of clinical training on top of that. So in essence, what the program already requires is the equivalent of a doctoral program, and certainly a practice doctorate in terms of not requiring a dissertation. And so from our perspective, what they're doing is recognizing and providing their students with the recognition of the level of work that is being required. They do already have a PhD in this area, and this would be for those that are not interested in pursuing the research aspect, but merely to get recognition for their students' work. This would only be the second DMP in the country at this point in time. Vanderbilt also has one. And they are going to be stopping enrolling students in the MS in medical physics and only using that as a fallback for students who do not complete the clinical training. There is a much smaller employment opportunity for students who only do the MS without continuing and completing the medical physics clinical, but that would still be a fallback option for them, but they wouldn't enroll students only in that master's program. And I think at this point I'll make sure I've stated that clearly. Is that correct, Dr. Clark? Okay. Just want to make sure that I'm not misstating something before I turn it back to the board. We do recommend approval on this, subject with the 5 annual reports.
Do you all want to make some statement about the program?
Yes. During this item, we believe that upgrading to the doctor of medical basically this American Board of Radiology, which is a we just really feel
Mr. Chairman, could I ask a question?
Yes, please.
I don't really understand exactly. Apparently, this is not a research dissertation requirement degree. It's a professional degree. Is that?
That's correct.
Okay. How do these people plug in? I mean, do they read MRIs, CT scans, Dopplers, or what? I mean, what's they interpret that, or how are they? What exactly does this person do once he obtains this degree in terms of how he plugs into the medical community and what service and what? I don't understand what he's doing.
Most of the medical physicists, probably 80% of them, work in radiation oncology clinics where they are in charge of doing dose calculations and making sure that the equipment's functioning properly, doing equipment calibrations. About 20% work in radiology departments. They have a similar job that is less patient contacts, more administrative, has to do with making sure that the radiology procedures that are used are both safe and medically effective. But they do not actually read the studies.
Okay. Thank you.
Sure. So right now you're granting a master's in medical physics, which
That's
is a
correct.
2-year curriculum, but don't those individuals have to do a 3-year residency to become ABR certified?
They have to do a 2-year residency, but the problem with the master's students is they aren't competitive to get into the residency programs that exist. And so what we're finding with our master's students, for instance, we've had 3 that have just graduated that have gone into the PhD program. 1 is transferred into the PhD program without getting her master's because they don't think they can get into a residency program without a PhD first. But what they really want to do is clinical medical physics. They have no real goal of pursuing a research career, so they're getting research training that they know they're not going to use because they see that as the only pathway to get to the clinical job market.
But with the PhD, they could do clinical.
Yes, they could.
But they're essentially being trained to do research and not clinical, and so this is more of a clinical pathway.
This is, yes, it's modeled after an MD degree. It's a professional degree, 2 years of classroom training and 2 years of clinical training, very similar to MD.
And after that, they still have to do a residency.
No. The 2 years of clinical training is adequate for the American Board of Radiology, and they consider that equivalent to the residency training.
Are you sure on that? Because I just read on the ABR website that they're only giving 6 months of credit, and you had to have 24 months of postgraduate work.
You still have to have professional, you still have to have clinical training as a physicist, but so do the students who go through the residency programs as well. The residency, you still need to have 2 years of clinical work. Want to expand on that? You're more involved in that.
My name is Nico Papanikolaou, and I work with Jeff. I'm in charge of the radiation therapy track of the program, and what you stated is correct. So if you look at the snapshot of what's happening today, the ABR today, only having had one DMP program to negotiate, they give the 4-year combined program, which is the 2 years of didactic and 2 years of clinical training. They give them the thumbs up that the 2 years of clinical training corresponds to 24 months of the residency program. So as of today, the DMP, the way it's approved and by CAMPEP, which is the accreditation body that we have, and it's perceived by ABR, fulfills the requirements of both the didactic and the clinical component that are required as prerequisites for the admission towards the ABR exam. Now, in 5 years from now, since we're lateralizing what we do to a medical degree, to the MD, there might be a change. They say, well, the DMP is a combined didactic and clinical training, and we want the residents to be an augmentation of that. But as it stands today, there's no further discussion beyond what has been said about such alteration. So the way it's forecasted is what we have is a combined didactic and clinical training that satisfies the requirements for admission to the ABR exam. So at the completion of the DMP degree, you become board eligible.
So you would be able to sit for Part 1 at that time?
Correct.
But if you do the master's, you're not able to sit for Part 1 at that time?
If you do the master's, you'll be able to sit for part 1, but to continue, well, and
You can't sit
for part 1?
No, you have to be in a residency program starting next year.
Sure?
Yes.
Okay. Well,
That's the 2014 rule.
okay.
So starting
today,
yeah.
you can. Today you can sit for the part 1. But as of 2014, correct, I should have made that qualifier. As of 2014, then you have to be enrolled in a CAMPEP accredited residency program.
Yeah, I'm reading off that website. It is the CAMPEP residency. Now, how many of these CAMPEP residencies, you said your graduates are not being competitive right now. Is there not enough residencies out there that are certified through CAMPEP?
Correct. There's more institutions that apply towards obtaining an accredited residency designation. But I think right now in therapy, in diagnostic, I think there's about 5 or 6 of them. In therapy, there's probably about 30
Yeah.
or so. There's more people, there's more institutions that are applying to do that. But with 30 and graduating 1 resident per year, which is typically what we have, it's a 2-year program with 1 resident in each slot. So that would be 1 junior and 1 senior every year with 1 graduating. So 30 residents graduating, and if we look at a study that was recently published forecasting the need for professionals in this field of being 150 to 200 some per year, then clearly there's not enough trained people that would qualify to become licensed in practice if that continues at that level. So the DMP will augment the numbers in that pool, potentially significantly, depending how many people you admit and how many programs you have. And if you couple that with an increase in the residency programs, which is going to happen in the next couple of years, I suspect we're going to have probably about 50 or 60 maybe CAMPEP accredited programs. The combination of those two will produce the 150 to 200 certified or certifiable, eligible for certification professionals per year.
So, yeah, and I looked it up. There's actually 38 accredited programs from this Commission on Accreditation of Medical Physics Education Programs. For the record, because we're using acronyms here, I wanted everybody to understand what CAMPEP stood for. So what you're saying, of those 38, they're really only putting out 1 per year.
Correct.
Which isn't going to meet the needs of 150 per year.
Correct.
So
closer to 1.5 per year on average.
1.5. So some of them are doing, but the opportunity for your graduates to get one of those 38 to maybe 50 residencies, they're not competitive because they go to other programs?
Our PhD students are very competitive.
Okay.
They go to places like the Mayo Clinic, Harvard, UCLA, places like that. Our master students can't get into even the lowest level residency programs now this year. And it's just going to get tougher in years to come. In addition to there not being enough residency programs, there's been an upsurge in the number of master's medical physics programs that have become accredited in the last couple of years. Seems like a lot of these physics departments across the country think that they can turn that into a moneymaker because they don't understand the dynamics of the profession right now.
So truly, in trying to understand this, your master's level graduates are not as competitive as they need to be. They're taking a tactic to take a PhD in order to get into a residency that they could then do clinical practice in medical physics, but they're training in a PhD that they really don't need the PhD because they're not going to do the research side of that. And therefore, you're creating a 4-year degree program which would make them much more competitive with the top-level medical physics residencies that they're going to need.
They would essentially be doing the residencies, and then they would just have to compete to get into the private work pool with the other ones who have completed the residency programs, but they would be competitive there.
Okay, yeah, because what it says is that you could use 12 months of credit for a doctoral level medical physics program, so the graduate would then go into employment and have an additional 24 months being supervised with another medical physicist who would then sign off on their ability to sit for part 2. Is that how it would work? So really what you're doing is you're streamlining the process for people that want to go into clinical medical physics, give them a direct pathway in a 4-year period to complete the master's level didactic program and the residency all in one, so they can come out, they're fully employed, and within 24 months of graduation, they're fully board certified.
Exactly, and at the same time, the students that go in the PhD program will know from the beginning and will be committed to an academic type career and a research-oriented program.
And is it my understanding the only other medical physics program we have in the state is UT Houston, Health Science Center Houston?
Yes, that's correct.
Okay. So,
and they are also working on developing this type of program themselves.
To further emphasize the statement that you made so eloquently about what they need is, I would say that we had about over 100 people applying to the one slot that we have for the residency in therapy this past year. So of the 100 people we had to pick as a committee one to admit, and out of those 100, about 65 had PhDs. So it's really difficult to pick somebody with a master's degree when you have 65 doctorate applicants to it that had a lot more training, whether it's research plus the academic training. So it makes it pretty easy to pick the PhD person to admit to the program and dismiss the master's.
how many medical physics faculty do you have in San Antonio?
In the therapy track, we have 5.
In the whole graduate program right now, we have about 30 altogether, not all of which are certified medical physicists. About half are certified medical physicists.
What's your projection when this is fully operational? How many DMP students could you be graduating a year?
We think 4 or 5. We're working with the local. The bottleneck here is going to be our number of clinical mentors and the clinical resources available. We're been working with the people at the San Antonio Military Medical Center. Dr. Tucker there is adjunct faculty. He teaches one of the courses now, and they have 5 more medical physicists there, and they're going to be hiring another one soon. And so we're hoping we can do some clinical rotations there. We have a long history, our institution does, of working with BAMC and the people down there. So that's sort of the limitation, how much clinical space we have.
Yes, I'm very familiar with that. I'm a graduate of your institution and BAMC as well. So, Mr. Chairman, I move approval.
Second.
Motion has been made and seconded.
Mr. Chairman, I'd like to just ask one more question as part of the discussion prior to calling the question. A note on the briefing from staff on this project that both the doctoral graduation rate, which we don't talk a lot about at this board, doctoral graduation rates, and the institution's meeting projected enrollments for new doctoral programs are both below state average, and that the institution has not been meeting projected enrollments for new doctoral programs. How will this degree program, or why will this degree program be different in terms of meeting, helping the graduation rate for the institution and helping to meet those projected enrollments?
Well, sir, that's for the graduation rate for the entire university, which is dominated by our interdisciplinary graduate program, which are all biology-oriented majors. Our graduate program in radiological sciences has graduated 88.4% of the students who have enrolled for the MS and 72.3% of the PhD students, for around a 76% total graduation rate over the duration of the program, and we've not had that kind of issue. We do have some people drop out or transfer to other schools, decide they don't want to be in the profession. We've actually only expelled one student for cause during the duration of the whole program.
So the overall doctoral graduation rate of 48% is a result of other program areas that
Yes,
related to PhDs in this general area are kind of at the upper end, I guess, of your blended
Yes,
pool.
we're just a much smaller program. Out of probably around 250 total graduate students, the largest we've ever been is around 60. And so last several years we've been graduating we've been purposely downsizing to prepare for the DMP program and only taking a few students, and our census has gone down from 65 to about 40 students in the program. Last 2 years we graduated I think 13 and 12 each of those years. We have a high graduation rate and a high placement rate. Our students, as I mentioned, go to do their postdoctoral training in first-tier universities. Many of them are in the military, and they go off within 5 years, several of our students have become directors of medical physics clinics and research labs across the country.
I appreciate the feedback.
Yeah, just to follow up with that, I think the problem, Fred, is the reporting on this is for the entire Health Science Center, which has many colleges. And the College of Medicine, which is, I think, where your program is housed, has excellent graduation. So I think it's a matter of reporting it in that regard. This program is different. I had to actually do some research on this. So I've read a little bit about it and got some information from staff who was able to research some of this. Medical physicists work right alongside radiation oncologists, so that's their role. So it's appropriate that they're trained in our medical schools. They're not there to replace a clinical physician, but to be an augmentation to that function for radiation treatment in primarily oncology patients, but it is in other patients. So.
The motion has been made. Any other questions? Seconded?
Second.
All in favor, please say aye.
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 Aye. Those opposed, same sign, motion carries. Next agenda item 5B is on consent calendar. I want to make a comment here before we go to the next item. About a year and a half ago, we had a long list of the programs which were not approved, which were more than 90 days old, and so on. McGregor and Dr. Gardner and his team, their team has done a wonderful job of reducing the number of programs which are older than 90 days. List has come down to 8-9 programs. It used to be more than 30-40 programs. Thank you very much, McGregor and Dr. Gardner. Your team has done a wonderful job.
Thanks.
Next agenda item is 5C, is consideration of adopting the staff recommendation to the committee relating to a feasibility study regarding establishment of a dental school at the Texas Tech University Health Science Center, El Paso. Martha Brown and Chas Semple from El Paso are here to make a presentation or answer any questions. Are they here?
They were earlier. Did you all want to come up, or were you just here for reference? Fair enough. I think they're just going to be reference if we have questions. Thank you, Mr. Chairman. The staff worked with the community in El Paso and worked with the other dental schools to pull data on the availability of dental education in Texas, as well as the demand for dental dentists in the state. And as you can see in the executive summary, the analysis ends up being that we do not see that there is a need for another dental school in the state at this time. The study shows that the state has 1,281 more dentists than the established national standard of one dentist per 3,000 population. So in terms of, in that regard, we do have a surfeit from what that national standard was set. In terms of the region, it is a lower density of dentists in the El Paso region, and there are a number of options that we made recommendations to try and address that, or that could potentially be used to address that. One was to look at adding additional funding to the Dental Education Loan Repayment Program, which provides support for loan repayment to dentists who practice in low service areas. In other words, low density areas for dentists, of which this would be one of the areas, El Paso region. The other is to look at expanding the number of dental graduates from the existing programs, which would be at a lower cost than starting a new dental program if it was felt that increasing the number would ultimately lead to greater numbers in the El Paso region. However, we did provide the alternative that if the legislature or the state were to determine that it was necessary to have a medical school in El Paso, the consultant that we used was a dean of a dental school, and he had worked for two different types of dental programs. One that is the traditional standard. There's one facility where all the dentists go, and their training is all done in the one facility, and they have a single clinic in that location for all their dental students. The second is for a distributed model, which provides for basically the dental students to get their training in distributed locations around the region. And if the need were to try and address some of the demand for additional dentists in that region, then we felt like it was more appropriate to try and develop the distributed dental education model rather than the traditional model, simply because it does get dentists out into the population more directly and does get the students training in those areas. And so in that regard, we felt like those were the best options that we could find under the current climate for dentists in the state and the existing supply. And so we did make those recommendations, and we do recommend approval of the dental study.
Any questions?
We've been working on workforce modeling with regard to physicians. Where did you find a ratio of 1 to 300, and how reliable?
3,000.
1 to 3,000, and how reliable is that?
If I could ask my staff to come up, I think Stacy may be the point, or Alan, Elizabeth, just to give us the background on where that number came from, or where the standard came from.
It's actually a standard used by HRSA.
And I'm sorry, I'm not familiar with HRSA.
The hold on one second. The Health Resources Services Administration of the federal government.
Okay.
So it's a federal standard.
Do they have applicable standards to what we're looking at?
They do not.
Okay.
We wish that they did.
Yeah. So, McGregor, just so I understand, this is a draft of a report we're having to file with the legislature according to Senate Bill 1020.
Yes, sir.
And it contains our recommendations in that regard. And our recommendation is to look at, rather than starting a new medical or a new dental school or expanding, looking at least a dental loan repayment program as a primary best option.
There is already an existing dental loan repayment program. We're simply saying that that may be a means to address the undersupply in the El Paso region, is to add additional funds to that dental loan repayment program.
Yeah, and it's my understanding also that El Paso is not the only region that is undersupplied.
That's correct.
Okay. So do we need to adopt this as our recommendation? Is that
Yes, sir.
would be appropriate? Yes. So I move adoption.
Do we have a
Second that.
So we have a-
That means we're not approving a dental school. We're simply recommending that we provide some incentives to what I'm reading is that it's not so much of a lack of dentists. It's the distribution of dentists into low manpower shortage areas.
Yes, sir, that's
And
correct.
That's in South Texas primarily, and in West Texas. So I think what David's proposing is that we try to provide some incentives through loan repayments to get dental students to relocate. Is that what you're saying?
Yes, and that's in on page 2 of the executive summary, and it's in the report. This is actually just a report we're issuing as dictated by the legislature with recommendations.
The specific answer to the question that was raised by the legislature was a feasibility study of putting a medical or dental school in El Paso. Our response was that we did not feel like there was the demand for an additional dental school in the state. And second, if there was the decision made to put a dental program in the state in El Paso, that it should be at the distributed model. The alternative to adding another dental school would be to provide some additional resources to the dental loan repayment program to get more dentists into those underserved areas.
And the one thing I thought was interesting on page 9 of the report under Figure 5 was in the state, 68% of our dentists train in our state. In El Paso, only 51%. So clearly they're attracting out-of-state graduates to El Paso. I would assume maybe stealing from New Mexico. I don't know, but
New Mexico doesn't have a dental school.
not stealing from New Mexico.
They tried. They actually did a similar feasibility study as well.
Mm-hmm. So I think that there's opportunity, but we probably need to have them directed to the least cost opportunity to do that. So,
Mr. Chairman.
All in favor, please.
Mr. Chairman.
You get a
Yes,
question?
Could I
Yes, sir.
ask a question? McGregor, the distributed dental school model, would that mean that one of the other dental schools within the state would have to take that initiative? How
No, sir. It's basically, and you all chime in as need be. The distributed model basically means that the didactic portion, the classroom portion, would be handled in El Paso at one location. The clinical portions would then be at distributed locations wherever the dental school could find faculty to serve as preceptors for those clinical rotations. And so it could be so that all the clinical rotations were not done in the dental school in El Paso, but could rather be out in a variety of locations in the area. Now, is that
correct?
Okay.
But at the same time, though, you could have the reverse, where the clinic or the didactic could be done in San Antonio, and then the third and fourth year clinicals be done in El Paso.
You could.
Is that the question you were asking, Harold?
Yes, I mean, could it work either way?
It could, yes, sir. If there were institutions already, the dental programs that were already interested in doing a distributed model, and they were willing to develop the faculty to serve as preceptors in those distributed locations, they could do that, yes, sir, by increasing the number of students there and placing the students in clinical rotations elsewhere.
So do they do those rotations? When you say other areas around El Paso, what are those? Are those other existing dental facilities?
Dentist office, primary.
There's a variety of ways you can do it.
Okay.
I mean, this is it's kind of open. You can go and have other dental practices. You can set up clinics, and that could be you could achieve some income if you had the other dental practices. It would. This is just a framework for a different type of school as opposed to the traditional model, which is everything in one location.
We don't have any of those types in this state,
No.
Bobby. So
This is
I
new.
think if you would look for theoretically at San Antonio, they may have a dental clinic in Austin, one in New Braunfels, one in Seguin, one in Hondo. And, you're getting the picture.
Right.
So your third and fourth year students would be in those communities, but they would have started out in the San Antonio in that way. But we don't have any of those models in this state right now.
It just seems to me that we would want to try, I would think, if it's anywhere similar to the medical community, that if they're doing those rotations in that area, they're more likely to stay in that area.
That's correct.
And that's what I would hope would be the goal, if that's where the shortage is. If they do those rotations in that area, they'll end up being in the El Paso or West Texas or South Texas areas.
But the bottom line is this report says we're not recommending a dental school in El Paso, but there is a need for a more geographic distribution of dentists.
Yes, sir.
Throughout the state.
And that there would be opportunities to expand the availability of dental dentists in the El Paso area because it is one of the underserved regions.
Okay.
Any other questions? All in favor of adopting these findings and recommendations, please say aye.
Aye.
Second.
Those opposed, same sign. Motion carries.
Thank you very much, Stacy.
Next agenda item 5D is consideration of adopting staff recommendation to the committee relating to the community college transfer student report. McGregor will again provide the information.
Thank you, Mr. Chairman. And again, the community college transfer report is another requirement of statute in Rider 55 of the General Appropriations Act. We are recommending approval of the transfer report, and basically what the transfer report does is provide a comparison of students who start at a community college, earn 60 hours, and transfer to the university versus students who started at the university completed 60 hours, so that they're starting at the same point. Both of them are starting with 60 hours, one coming in from the community college, one having grown up in the native to the institution, and comparing them in terms of their graduation rates and completion rates and time to degree and number of semester credit hours required for their degrees. There is a large volume of information, obviously, in this when we break it down to the individual institutional level. But what we've done is try and figure 1 on page 2 to provide you with a summary overview of the completion rates, time to degree, and the average number of credit hours attempted. And if you go clear down to the bottom for the statewide summary, you can see that the average completion rate for the native students is approximately 84%. And for the community college transfer students, it's 68%. So there is a significant variation there in terms of time, the average completion rate, even for students with 60 hours. And that's in a 4-year period subsequent to attaining the 60 hours. So once they get 60 hours, that's the cohort. And then 4 years down the road, we're evaluating whether or not they've completed. And so that's the time frame, and you see a significant difference there. You also will see a significant average time to degree difference, with native students taking up to 5.37 years and the transfer students taking 7.42. So, I mean, they're...
Remember, as you look at this, that this is students who had already completed 60 semester credit hours. McGregor said that, but I want to underline it, because if you look at some of these numbers, say, well, the completion rate's 84%, and you think our statewide 6-year graduation rate is 56%, the difference is these are students who already reached the junior year. So just bear that in mind.
So the vast majority of students who are going to drop out do so before that point in time, before they've attained 60 hours. And then finally, the average number of semester credit hours attempted is kind of the bright point for us, in that you're not seeing a significant difference, with the variation only being 2 semester credit hours between the native students and the transfer students. So we're not seeing that there is a significant number of hours that students are presumably losing through transfer. And that's actually a very good point for us, and shows that the efforts that the institutions are making with regard to their articulation agreements and those type of things are having an effect.
So, since it's not the accumulation of unnecessary, wasted, or non-transferring credit hours, what explains the 2-year gap in time to graduation?
We believe that it's going to be significantly more part-time students. So, I mean, they're coming in from community colleges where they've been working. They're continuing to work, and so they're taking fewer hours than students at 4-year institutions who may be able to go attend more full-time. And so that's going to have a different effect. They're different types of students.
And anecdotally, that's exactly what I would have expected. But do we, from a statistical standpoint, do we have the data that backs up that?
I don't think we showed in here whether or not those were part-time students, the difference in the part-time students. But for future efforts, we can certainly look at that.
How about ethnicity, McGregor?
I'm sorry?
Ethnicity?
We did not pull the ethnicity in that way.
One question. Have we compared these figures for Texas to national standards? For example, what's the discrepancy, if any, between native student graduation rates and transfer student graduation rates around the country? Because I'd like to know if we have a particular problem in Texas, or whether this is just characteristic of...
I think one of the challenges is this is a very unique data set that we're working from, in that we do have the capacity to identify large enough populations of students that have attained 60 hours to compare them native versus non-native. And I have not seen another study, and the folks that worked on the transfer study, I haven't seen anything like that, nor have they. And so from our perspective, this is some very good Texas data because of the data systems we have in place, and it's not going to be comparable to other national sets.
I had a question. Is there any sort of breakdown between traditional college students and non-traditional college students in terms of completion rate on the native versus transfer?
No. And again, that would be kind of similar to the part-time, full-time question. If you're defining traditional being 18 to 22, so it's further demographic breakdown that just because of the volume of data that we're dealing with, it just adds a significant amount of additional work. And so it's something we could do in the future if that was something the board felt like we needed to.
This is a type thing that generally happens when you do a study for the first time. I mean, nobody's had this data before, and what it does is then it raises these additional questions that you can't really know to ask them until you see what's here. And so I think this is a type thing that staff could do some analysis on different things to see if it's worth pursuing. But generally what happens is once we get something like this, then we begin to learn more because it does raise other questions.
I have a comment or question. I looked at some of this information, I believe is on our website, and it's community college students that are transferring to your academic institutions after 60 hours. And now this is unofficial, this is just my own personal observation of what I saw as I went through that. And it looked like there was roughly about 20% of the students that were getting into academic trouble in the four-year institutions early on in their academic career, or at least there was a higher percentage of what I had anticipated, because I've always considered that a student with an associate's degree to be a student not at major risk of not being able to finish their curriculum. But as I went through the numbers, I was a little bit surprised, and it would appear to be a little higher percentage of students that were finishing a 60-hour program, entering into the academic transfer, these academic transfer students entering into the four-year institutions, and then after the first year having a less than 2.0 average. And that information is available, and y'all got the numbers because I've seen it. So, I'm wondering whether or not that's something we need to look at.
I'd be interested in knowing
which. Is there a clear
which
understanding between what the four-year institutions or the community college understand as being, college ready at that level, and being able to articulate into the four-year institutions and be ready?
I guess I'm not quite sure what data you're looking at.
We've got it. I mean, it's in our agency.
We have some data like that related to dual credit, which I've seen some numbers that are like what you say. I don't recall. We do have some other numbers. I know Susan has in terms of the transfer students in grade point.
Somewhere, I think, on the website that says, well, we're tracking the students with 60 hours, and then we're determining how successful they are once they transfer from the associate degree programs into our four-year academic transfer institutions, and just ascertaining how successful they are once they get there. And the numbers were a little lower than I anticipated, and that may be one of the reasons that we're seeing some of this. And Susan, do you know anything about that?
I'm not sure. We have multiple reports that
I'll
look at transfers, but I do have.
Maybe perhaps we could have a conversation about it.
I'll find it out, and I'll let you know.
Because I have
which one.
one that has transfer data, and it has the GPA of transfer students at universities for the following year. Has it divided out by those that required developmental ed and those that didn't. But it's not at the 60-hour level.
Right.
It's all students who transferred at that point.
What I saw was individual community colleges. It showed the number of students that transferred with associate degrees to four-year institutions, and then it showed the percentage, the number of students that ended up finishing their third year with a less than a 2.0 average.
Okay, and I just got an email from one of my staff who is listening in, and she said you're talking about the transfer report, and those students completed 30 hours, not the 60 hours. So there is a difference there.
There's a difference at the.
But it still indicates that there may be a little bit of a hiccup there in terms of why some of these students are taking a little longer to finish in their degrees.
Well, attrition is going to be higher between the freshman to the end of the sophomore year than it will be after the sophomore year.
I agree.
So that may be part of it, but we can certainly continue to discuss it.
There is. I do think it's important. I bring this up a lot that 35% of our baccalaureate graduates in the recent years have had at least 30 semester credit hours from a community college. So they're making a huge difference in terms. But we do have those numbers, and it's not unusual for students to have more difficulty academically the first year they go to an institution than in subsequent years. That's just part of its cultural, part of its just a transition process. But we'll look at those numbers more carefully for you.
But I think it would be a good number to know in terms of our ability to anticipate how well prepared those students are when they leave community colleges and go into the four-year institutions, and being able to track and understand and know how many of those articulate into those four-year institutions and succeed.
Here's a study an evaluation we're doing of our voluntary transfer compacts, which will help that. Is from those compacts, we really know what course the students should take after, say their first engineering course. What's the subsequent course? And we're working with the people who designed the transfer compact originally. We're doing a study to see how, in fact, is that student doing in their second course. So we're going to get an evaluation, because if they develop, here are the learning outcomes that you should have in the first one. Now we're going to get some feel, and it'll probably be another year and a half, in terms of how are they actually doing when they take that next course. And if they're going from a community college to a university, or from even a university to a university, how well prepared were they, or at least how well are they doing in their subsequent courses. So we'll have some real hard data for you in some very specific areas that we think will be helpful.
Thank you. Commissioner, you had something?
Yes, I was going to say that we clearly need to look at these data more closely. We've got a larger number of students that start out in community college. There's a lot of attrition in community college to begin with. The data that I've seen nationally suggests that transfer students complete their baccalaureates at approximately the same rates as native students. And the data that we're now hearing about from Texas suggests a significant gap. We are way behind in achieving our long-term goals for college graduates. We're sending more students to community colleges who want to transfer. We'll never reach our long-term goals, our post-closing the gaps strategic goals, if we don't address that discrepancy. That's huge.
Yeah, Dr. Tush.
So the question on that, I'm sorry, the question on that would be, and I don't know if you have the answer or not, is it better for the student to complete the 60 hours, gain an associate's degree, and then to transfer? Is their success better than after 30 hours and then transferring? Is there any information that we have saying that the best route for you is to stay for the 60 hours, get your associate's degree, then transfer? Or no, as soon as you identify that you're someone that can achieve a bachelor's degree, it's time to move you into the bachelor's track?
The challenge is that we don't have data that goes back longitudinally far enough to allow us to look and compare to the quality of the student in terms of individual course completion and grades, to be able to say, okay, this student who got an A in this course versus this student who got an A in this course and transferred, and how did they do comparably, one staying in community college and one going forward into the university quicker. We don't have the data to be able to do that analysis as well. And
Gregor, correct me if I'm wrong, but David, I think what we know is that the longer you're in school in the first couple of years, regardless of whether it's a community college or a university, the more likely it is that you'll persist to graduation. So we don't know whether it makes a difference whether you complete those 45, 30, 45, or 60 hours in a university or a community college. We just know that the longer you're in, the more likely it is that you'll graduate. We know that the question is whether achieving an associate's degree makes any difference. We know that if you stick around for 60 hours, you're more likely to complete a baccalaureate than if you transferred at much lower levels, but we don't know whether achieving the associate's degree itself makes a difference. I suspect that it doesn't. It's the accumulation of hours.
Mm-hmm.
that are more likely to lead to persistence.
And the same data holds true if you're a native
Yeah.
university student. I think this reflects that to some extent.
Right.
The real issue is getting between the first year and the second year.
And then the second and third.
Second and third.
Yeah.
And I think you've seen even some of this reflected in Lee's analysis in terms of financial aid, where you see the impact in the first year with financial aid really is more important than when you get further down because they've already made a commitment. So, but this is something we're doing analysis with all the time, and we will have, as we have more, and what McGregor was referring to, I think, is that having grades for classes. As we go forward, we'll have more data on grades for individuals than we have now. We really only have, only really a year now of grades, specific grades. We can calculate grade points, which you've seen in those previous reports. But we are able to track students for 15 or 20 years without grades in terms of knowing what happened. So we really have a lot of people who are doing a lot of different things in their patterns. It's really hard to say traditional versus non-traditional because it breaks down even more than that, and because that just means different things. And so part of the big factors is what you heard in the outcomes funding report earlier. Some of those at-risk factors that are included in the outcomes are really have a big variation in terms of whether students are going to graduate or not. Do they need developmental ed? Are they poor? Just a number of those things.
But it does seem, as the commissioner was saying, that if we're funneling a lot of folks to the community college, I do think this really bears to understand, kind of to what you were talking about, Dennis, is from a preparedness standpoint, are they getting the same thing that puts them at the same position to be successful those final next 60 hours? Yeah. And I think that's the big question to try and understand, because it is a significant gap in the achievement of the degree and the time to it. We've already established that it's not because they're taking too many courses or unrelated courses or those kind of things. And so that's my question. And if that's our goal, that we're funneling so many there, we got to make sure that they're when they do transfer, they're prepared and ready to go.
And one of the things, as you look in the report on page 8 and 9 at the recommendations, the key recommendations that we make are to encourage participation in statewide transfer compacts, to have faculty committees developing student learning outcomes, which we are now have completed the courses. By the end of this year, we will have completed courses equivalent to 60% of the total semester credit hours generated at the lower division will have learning outcomes attached to them. And that's brand new in the last 2 years. We've gone from 0 to 60% in 2 years with the work of faculty committees and the staff to get specific student learning outcomes and common learning outcomes for those courses in the ACGM. And so that's a major step forward, and we want to continue doing that. So, there are several things that we do make recommendations on for the institutions and for the state as a whole in order to try and improve and react to some of the data that we're seeing in here.
I have a question, McGregor. Is there any value that you could see where we could work towards identifying those institutions in our community college systems that are more successful in terms of their 60-hour completers that go on to complete their baccalaureate degrees in a timely manner? Is there a way of identifying the ones that are doing well
Yes,
and the
sir.
ones that are not doing so well? And then maybe learning from the ones that are and understanding what they're doing to get their students prepared to make that transition into those academic transfer institutions?
At the community college, you're talking for the community colleges?
Yes, sir.
Yes, we can do that.
Can we rank them?
Great.
The purpose of this is to allow students and parents to be able to look at those institutions that are performing well, and when they make a decision as to where they're going to send their student to college, then at least it can be a factor that they can look at, that these students complete 60 hours at this institution, and they generally will perform better at the academic transfer institution, and their chances of completing their degree on time is better than if they go to this school that may be located, and I'll give you an example, in East Texas, we've got probably 4 or 5 community colleges that are located within an hour's drive of each other. So they could easily go to judge within those 4 or 5 institutions as to where they have the best chance of perhaps being prepared.
Yes, sir.
Is that information obtainable, or is it in the form that we can see it, or could we work towards getting that information?
There actually is information online available that shows you by community college and where they transfer how well the students are doing at that school. That's currently online.
Yeah, that's maybe the information I've been looking at.
It's on our website?
It's on our website.
Yes, sir.
Can you email at least this committee, the link to that so I can find it?
I'd like to ask if that could be sent to all the board members, if that's okay.
Yeah, that'd be.
Also, is there any value in us evaluating that as an agency from time to time and identifying the ones that are performing well and recognizing them and doing things to help the others to get up, not to be punitive in what we do, but just best practices?
And we certainly try to do that, not only with like the Star Wars that you mentioned earlier, but also trying to develop the best practices from one institution and having them replicated through Perkins Leadership Grants and those type of things to other institutions. So we do try to do that in some ways. I think there also the institutions have opportunities to identify their peers that are doing perhaps better in certain areas and reach out to them.
And I do realize there are variables in terms of certain institutions that are dealing with more students that are at more risk, and so that needs to be factored in. But in general terms, we should be able to identify those institutions that are doing well and the ones that maybe could do better.
Yes, sir.
Thank you, Mr. Chairman.
Any other questions?
Yep. In your figure 1, it says average number of hours attempted. I am assuming that's for the ones that were graduates, correct? So once they got their bachelor's degree,
correct.
The total. Now, we flapped our wings an awful lot about more than 120 hours and wanting to get the number down to 120. I didn't have that experience in college because I took a lot of enrichment courses and had carrying loads well above 18 hours just because I wanted to take those classes. What we're talking about is students who've been meandering through the entire process, taking courses that didn't apply to their degree and then having to take more to actually get to the degree. Is that the focus?
They would both be in this pool. I mean, both those that meandered and those that took enrichment courses.
But there's nothing wrong with the people taking additional courses for enrichment if they're enrolled as full-time students, is there?
In terms of the investment of the state has determined that if a student takes more than 30 hours beyond their degree, that is excessive.
So 150 is the number?
Yes, sir, in terms of at what point in time the institution starts to charge them out-of-state tuition.
Okay.
The state pays for each additional course. And if you were, say, at UT Austin, which has a flat rate now at 15, beyond that, the state is paying for classes. The state's paying for 6. If they take 7, the state's paying for 7. There's an additional cost to the state.
But the state was going to pay for that class whether I sat in it or not.
If you're sitting in the class, the state pays for that class. You only pay, if you have 5 students in the class, the state pays for 5. If you have 10, the state pays.
Oh, on the formula funding?
Yes, on the formula
funding. I see what you're saying. Okay, I get that. Well, then couldn't we alter the formula funding so that people on a heavy load wouldn't necessarily be funded additionally?
I'm going to let Susan Brown answer that because if I answer it wrong, she'll hit me.
Yeah. I mean, you understand where I'm going. I mean,
One could do almost anything.
I'm very much in favor of an efficient pathway to getting your 120 hours in your degree, but along the way, if in 8 semesters consecutively executed, you can take enrichment classes, I think that's a great college experience.
We would
the state
agree.
paid for it.
That would, the institutions would probably have an issue because that would require a whole lot more reporting on their end to determine whether the student was taking it for enrichment or if And if they took or just meandering around to see if they want to do a different degree. And so if you take one course and you say, I really want to change my major over to, that area, then all the other courses you've taken that are no longer in that area, what do those become? And you would raise a whole lot of issues that would have to be sorted out, probably on a student-by-student basis.
Okay.
So I think the legislators probably made the determination that, 30 hours, basically 10 additional courses over what is a standard course load is enough meandering.
Or enrichment.
Or enrichment.
Or graduate in 3 years and you enter through a master's program before you get the medical.
I didn't do too much meandering. That's all right.
A lot of enrichment.
Let me talk to me about these articulation agreements. We've talked about them in the past. Are we about to get a report on our progress on implementing these fully, and the degree of participation voluntarily on the part of these institutions? Because I think we're coming up to a legislative session that if we're not getting voluntary participation, maybe we need to ask the legislature to ask the institutions to re-examine their commitment to academic excellence.
We can certainly provide you with information on who's participating in the transfer compacts. Yes, sir.
Maybe that's something we want to talk about next Wednesday.
Okay. I will have staff have that information available.
Any other questions?
So we need to adopt this. I move adoption.
I'll second.
It has been motion has been made, seconded. All in favor, please say aye.
Aye.
Aye. Those opposed, same sign. Motion carries. Next agenda item 5E and F are on consent calendar. Agenda item 5G is update on 2012 research assessment program in accordance with the Texas Education Code, Chapter 144. This is item for information only. No voting will be necessary. And McGregor will give us update.
Thank you. This is just one of the required projects that we have to undertake in accordance with statute. The coordinating board staff, my staff, works with Legislative Budget Board to identify 3 special items projects that are funded through the Appropriations Act, and that are then, we bring in external experts who review these projects to determine whether or not there is a value to the state in continuing the funding for them and the quality of the programs. Following the presentation, the reviewers provide a report, basically like doing a doctoral program review, where they give us a report, the institution provides a response, and then we provide that to the legislature. These reports are actually being conducted at this time, and I believe we'll be bringing this back to the board for approval at the October board meeting. And it was a situation where, in working with the LBB, we were not able to identify the specific programs in enough time to have the reports ready for the committee meeting, but we hope to have it ready for the October board meeting. And so we just wanted to let you know that these 3 programs are in the process of being reviewed, and that we will have further discussion at the board meeting.
Any questions? If there are no questions, we can move on to the next agenda item. Agenda item number 5H is consideration of adopting the staff recommendation to the committee to award a nursing innovation grant to Trinity Valley Community College to develop 60-hour concept-based curriculum leading to an associate degree with a major in nursing. And McGregor will give this background information on this.
Thank you very much. This is a situation where we had Trinity Valley Community College and several of its partners working to develop a curriculum that's going to lead to a 120-hour baccalaureate nursing program with a concept-based educational program as opposed to a lecture-based program, so that the students are going to be expected to learn the material and then apply it more directly and in an ongoing basis throughout the course of their studies. And so that it's not, you get all of the nursing text materials in 2 years and then you get all of the clinical experience in 2 years. It's going to be blended throughout. And what we have proposed here is to provide support to this consortium to develop a 60-hour concept-based nursing education program at the associate level. And this would be a significant reduction from the current 72-hour standard nursing education program associate degree to the 60 hours. And so we're very gratified by the program and the opportunity to try and streamline that curriculum and to provide opportunities to cut off a semester of time required for the degree without loss of the level of educational quality. And the Dean of the Trinity Valley program is here if you have any questions specific to the program, but we are recommending this program, and we look forward to working with them as we go forward and seeing this program being developed and then hopefully expanded to other community colleges. Are there any questions?
Thank you, McDowell. Any questions?
I have a question.
Yeah, do you want to come on up?
Why don't you come on up, please?
I understand that when we brought up the fact already that the State Board of Nursing Examiners have a lot to do with the requirements for degree approvals in the state of Texas. So how do they play into this decision today?
They've been part of. We had a grant last year, the Perkins Leadership Grant, that started the kind of the basis for it, and they were consultants in our. They came to all our meetings.
So you're saying that we're going to reduce the requirements for ADN
the semester
degree
hours, yes,
from 72 to 60.
Mm-hmm.
Now, how's this going to impact the other ADN programs across the state?
Well, we'd like for them to come join us once we can prove that it's a good thing.
That would be good. I mean, that would be a good thing because
Yes.
we could address the shortage and get and save students money and allow them to get through the program a little faster.
And one thing I would like to say is we've gone back and forth on this for quite a few months in here, trying to find a middle ground. My goal is to get to the 60-hour associate degree, and I think one of the challenges that we're looking at is how we're going to implement this in terms of there's been some strong interest in having a 1+2+1. In other words, having a 1-year piece of general education followed by 2 years of the nursing program requirements, and all at the community college level, and then completing the final 4th year at a university. And one of the challenges that I kind of raised is that kind of takes the ADN from being a 2-year degree to a 3-year degree. And so we negotiated to the point where we're going to develop the ADN with the 60 hours as the requirement, and move that far together, and then try and figure out how we go if there's further steps that we can take. Because ultimately we do want to get to the 120-hour BSN as the standard, and we hope that the concept-based nursing can provide us with the mechanism to get there. And so we're going to continue working with them as we move forward to try and determine the best route to get those students through in a timely manner without increasing their time to degree or their cost to get an ADN.
And this will still allow them to sit for the RN
Yes.
state board with the
Yes, that is
60-hour BSN degree. Now that is that
ADN.
from ADN degree?
60-hour ADN.
Yeah.
Mhm.
Now is this from beginning to end, from the time they leave high school, they enter into a community college with their prerequisites like nutrition and A&P, and then that's all included in the 60 hours?
Mm-hmm.
Okay.
That's why we really feel like this is a great step to take.
I like this.
Is because we are saving time and money for the students to get to that ADN, and we hope in the long term that by reducing the time to degree at the ADN level, that will encourage students to continue on to get the BSN, which is a strong focus of the consortium as well.
Yeah, now, can I ask this too? How is this going to affect those students that leave with an ADN degree with fewer hours to articulate into a BSN program and still finish that with 120 hours? Is that going? I mean, they've been traditionally leaving with 72 hours.
Right, but they weren't getting full credit for those 72 hours at the university.
Yeah,
So this way they'll be able to get then full credit for what they're doing.
For the 60 hours.
Right, and then they'll take another 30 hours of the general education courses like the governments and histories and the statistics, and then they'll have the last 30 hours, which they could continue those 30 hours of general education courses at the community college at the lower cost, and then go on to the university for the last 30 hours of the baccalaureate or into BSN's courses.
And the statewide requirement is that the last 30 hours have to be at the degree
university.
granting institution.
At the degree granting institution, yes.
Are there other programs in other states, something similar to this? Have we looked at that?
Well, the concept-based has been adopted at North Carolina statewide by their community colleges.
For 60 hours?
Not the 60 hours, but the concept-based part of it. They are.
Is there any, and this may be, I'm sure this is political, and you may not be able to answer it, but is there any thing or anything that you're hearing to move more towards the BSN as entry level into RN nursing?
Not entry level. They do want to encourage our students to go on.
I agree with that, but entry level, I'm against that as entry level into
right. We've been fighting that for many years.
Yeah, I've fought it for
so that's
a long
why
time
this
myself.
This is really fun to be doing something proactive rather than reactive, which what I've been doing a lot in my career in associate degree education. So yes, we want to preserve the RN.
It's entry level into
yes.
ADN is entry level into the nursing profession.
Yes, we want to preserve that, but we do want to encourage our graduates to go on.
I don't disagree.
Yes.
Now, is this a grant are we awarding the grant? Is it
yes, sir.
An agency?
This is from the Nursing Innovation Grant Program, which is part of the tobacco settlement funds. And so we have a significant amount of resources every year that we can allocate out. And so this was within the existing budget amount for that program. And we're merely targeting it to this program because we felt like it was an appropriate item coming forward separately.
Do we anticipate any drop in your board pass rates when you go from a 72 to a 60-hour program?
I hope not.
Yeah, I hope not. It depends on the quality of students you continually attract and how right. rigorous your program is.
Right, and we're going to do this at like 6 or 7 community colleges.
Pardon me?
We plan to implement this at 6 or 7 community colleges starting in the fall of 2013.
Do you know who those colleges are?
Yes, the larger ones are El Centro College, Houston Community College, San Antonio College. Then we have some smaller ones, Howard College, Wharton County Junior College, and Weatherford College, and then Trinity Valley. We're more of mid-size.
Do you have any resistance from the administration in terms of reducing this? Because, of course, the institutions are receiving the contact hour funding for additional 12 hours, which y'all are now cutting them out of.
Well, the contact hours probably are going to be pretty similar because we're changing to a 4-to-1 ratio for clinical and lab to semester hours rather than the 3-to-1. So the contact hours aren't necessarily going to decrease, but the semester hours will.
It's not going to cost the institutions any money to go from a 72-hour
program. It probably
program.
will a little bit, but I think they see the writing on the wall in terms of 60-hour mandatory coming.
That. Yeah, I understand that. Yeah, they see the writing on the wall.
Yes, you mentioned North Carolina as an example of where this has been implemented. How long have they had it implemented, and what were the results?
My understanding is that they've been good in terms of their board scores. Yes.
So their graduates are scoring well.
Yes.
Were they able to attract more?
I don't know enough about that.
So there's Dr. Stevenson, is there, this, y'all, lots riding on y'all's shoulders here because we want y'all to be successful here. Because if this could really could be significant in terms of spreading this on across the rest of the state, right?
Right.
So y'all gonna make this work.
That's my goal.
I think you'll hear all of us hollering real loud if it is successful as we hope it is.
I've been involved in helping establish 2 nursing programs, one at Panola College many years ago, and as an ADN program, and a BSN program at University of Houston, Victoria. And I understand the politics on the State Board of Nursing Examiners. I've testified before them twice, and there's a little bit of friction between ADN people and BSN people. But I'm a firm believer that we need to keep the entry level into nursing at the ADN level, because that's
Right.
the most efficient way to address the shortage.
And that was the beauty of it in our Perkins Leadership Grant last year, is we did have universities and community colleges on there, and we really came together, and it really took on a life of its own. We were only intending on coming up with these courses that we then would each go about our merry way and implement it, and then it really took on a life of its own and led to this other grant, and so we're continuing the collaboration, so we're really
Good job.
excited.
Good job.
We've got a lot of opportunities with this one, so we're very excited.
Move approval.
I second. Gladly second this motion.
All in favor, please say aye.
Aye. Aye.
Those opposed, same sign. Motion carries.
Could we get some feedback on this in a year from now or 2 years from
Absolutely,
now?
absolutely. Yeah, it's part of the grant.
I
So
wanna hear.
we'll definitely have updated report. And I would really want to thank you very much for all the back and forth.
Thank you.
It's been a good process for us.
Next agenda item 5I is report on the fiscal year 2007 through 2011 low producing programs review. This item is only for information. McGregor will make the presentation.
Thank you, Mr. Chairman. As you can see in the report, last year we had 549 programs identified as low producing from the associate through the doctoral levels. This year, in the second year, we only have 80 programs that were identified as low producing. Of those 549 programs, last year, 249 received either a 4-year or 2-year exemption. And of those 249, 182 that received exemptions this year, received exemptions last year, are still low producing this year.
Yep.
So they haven't, some of them have, about 60 of them have been able to become non-low producing, and the remainder of 182 are still low producing. As we're going forward into next year, we anticipate that we'll have about the same number of programs, new programs identified as low producing, but then we will also be reevaluating those programs that receive 2-year exemptions for whether or not they have met the standard. If they have not met the standard, then we will be denying. If they requested another temporary exemption, we will review that, and then any appeals would come to the board. But for this year alone, there were 80 programs from the associate through the doctoral level identified as low producing. Of those, you can see that 34 were associate, 15 baccalaureate, 22 masters, and 9 doctoral. And the percentage of the total programs you can see is very small at a total of 2.2%. Of those 80 programs, on the next page, you can see that 24 requested phase-outs, 10 requested consolidations, and 44 requested temporary exemptions. There were also 2 reporting errors that we corrected and resolved going forward. Of those, we denied 2 consolidations, and we denied outright 23 of the 44 low-producing program temporary exemption requests for 2-year exemptions. Of those programs that were denied, I believe there were 10 or 11 that have since submitted additional information for an appeal. The staff is going through and conducting the reviews of that information. We may, based upon the additional information, make a determination that they did deserve a 2-year exemption, and so the number will go down from those reconsiderations. And then any that are left will have to make an ultimate decision as to whether they are going to appeal those programs to you all as the board. And at the October meeting, we'll be bringing forward all of those programs that submitted an appeal, the ones that we recommend for temporary exemption, as well as those that have requested the board hear their appeal. And so it's going to be a much shorter process this time around. Last time for the board meeting, we had 21 different programs that requested board's appeal. And this time we'll have an absolute maximum of 11, I believe, maybe of 14, between 11 and 14, but we'll lose some of those to the staff decisions and to deciding not to appeal. Now, is that as clear as mud?
Any questions?
Is our I assume that what we're doing, Mr. Chairman, may I comment? Okay. I assume that we've got an agency, there's a policy that's been adopted by this board in terms of what defines a low-performing program.
Absolutely.
Okay. When was that policy adopted? And
the policy was adopted.
Has it been looked at in
FY10?
Pardon me?
We adopted it in FY10. The first review was conducted beginning last February of 2011, and the reports and everything were due by the beginning of June, and the board considered appeals last October. The second round, we provided data to the institutions and the list of low-producing programs in February, and again, went through the process of them providing the information over the course of February to June. We reviewed the information July, August, and then provided them an opportunity to appeal.
Let me clarify the most recent rules were adopted when McGregor said we've had some rules in place for many years, but they were not as clear and as focused as the current rules. So in case you're wondering about how long have institutions been aware of low producing being an issue, it's been really forever.
And we will be considering changes to the rules as was requested by the board later on in this meeting as well. But this is just based upon the current standards of 2 graduates per year at the doctoral level, 3 at the master's, and 5 at the baccalaureate and associate degree.
Is there, Mr. Chairman, can I ask you, what's the incentive for these institutions to want to hold on to low-producing programs if as long as we don't penalize them in terms of their resources, where they could perhaps take those resources that are being spent on low-producing programs and redirect those resources into areas that would most benefit the institutions? Are they being penalized financially, and when they lose these programs, is there incentive to hold on the programs as to hold on the money, or can we allow them to still keep their funding and reallocate those resources in areas and the programs where they can grow strong programs instead of hold on to just weak programs?
I think it depends on the institution. As you will see with the recommendations that are made for the new rules, some institutions feel like for local workforce needs that they need to continue the program. Others feel like the availability of a comparable degree program within a geographic area justifies maintaining a small program. Others argue that the cost is very low, so there's really no drawback to continuing a low-producing program. So there's a variety of arguments that are made. The fact that the board has looked at in the past has certainly been, if it's a low-producing program and you're not able to attract students to the program, then perhaps the reallocation of resources can be beneficial to other programs that have the opportunity to be more successful. And so, I mean, I certainly think that's been the counterpoint.
Can the institutions, or any incentives for those institutions from a financial standpoint to voluntarily close those programs on their own and then to hang on to the same money and reallocate it to other programs where they can build on their strengths and not on their weaknesses?
It depends on what program it is and the cost of various, whether there are labs involved and purchasing of materials and that type of thing, whether or not there are faculty who are available to teach it as an overload with no cost. So, I mean, there are a lot of different variables that come into play depending upon the institution and the discipline. So, I mean, I wish I could give you a direct answer saying if you cut one program, you're going to see a net result of 1.5 faculty being able to be reassigned somewhere. And we just aren't able to do that. And one of the challenges that we face in terms of evaluating this in the short run is when you close a low-producing program, you are still required to maintain that program and do what is called a teach-out for those students who are already admitted into the program or have declared that major. And so for a baccalaureate degree program, it's at 150% of the time to degree, or 6 years, that the institution has to maintain that program. So in the short run, you're not necessarily going to see any significant savings, and the institution won't. And in many cases, you're not going to see it for at least 3 or 4 years, because those lower division courses that are taught for that discipline may be used to serve other areas. So they're being used in the core curriculum. So if you in the physics is the best example. You know, the lower division physics courses are being used to support engineering and chemistry and other degree programs. So those faculty are still going to be teaching those lower division courses, and so it's not until you get those students into the upper division and on through that you're going to start to see a fewer courses being needed in the upper level physics. And so it's an extended period of time before you can truly evaluate any savings.
This is not forcing them to not teach freshman physics.
Absolutely not.
It's just they just can't award that degree.
Correct.
Okay.
McGregor, I'm looking at page 3, and some of the programs which are low producing are STEM programs: science, technology, engineering, and math programs.
Yes, sir.
I hate to see these programs go away. Is there any way we can recommend to these institutions that have a joint program with the other institutions so that they don't remain low producing programs, just like the thing that we saw with Dallas and San Antonio, that 2 institutions are working together, rather than we are already very weak in STEM. We need to encourage the STEM program, and I see 15 computer and information science program, 15 of them. Then I see 3, 2, a lot of them are STEM programs. So is there something our staff members can do, or you can do, to encourage these people not to discontinue the program, but to work with one another, have a joint program?
I think one of the challenges is the fact that, I mean, although there are 15 programs, those 15 programs represent less than 2% of the total graduates in the field. So in terms of the impact of maintaining those programs, I'm not sure whether or not there is truly a viable means to do that. However, I think one of the areas, as Dr. Gardner suggested, that is of interest to you is the online education. I think working with institutions who do have very successful programs in areas like computer and information sciences, and having those institutions provide and develop online education programs in those fields to be able to be offered in these areas where the low producing programs were unable to support a full cohort. And so I think in that regard, I think we can encourage those institutions that do have successful programs in these fields where other institutions are not able to sustain, to go in and offer online education and encourage students in those areas to go there.
And do a joint program also. They can work with one another and do jointly.
Yeah, and I think that we should at least begin to look as staff, as some of these patterns emerge about low-producing programs. Are there some areas, and this, the one you cited may be the particular one, where we ought to maybe be a little more, begin to be proactive in terms of identifying some areas where we should, more aggressively encourage someone to develop these and work with institutions to provide these programs to remote areas which may never have enough local interest to have an entire department, but they could provide the lower division courses, and they could work from that base and use the computer the access to the online programs from that institution.
And although
there are ways we could think to do that.
And although we are closing 15 programs, there still remain 93 comparable programs in the state. So I mean, it unlike physics, where there are not a huge number of programs. For computer and information sciences, there are a significant number of programs spread out across the state where students do have that availability, even if it may not be in the specific niche area that we're closing.
And one thing that doesn't show up here is that computer and information sciences is really a fairly broad category. So there are a lot of multiple variations of programs within that. But that is actually one program that is probably more ideally suited to offering online, because if somebody's going into this area, they certainly should be able to function in an online environment if they're going to be productive in that field at some point.
Maybe we should prepare another table here, STEM programs, low producing STEM programs, and nursing and STEM program and non-nursing and non-STEM programs. That way, it will be eye-opener for us to see which programs we are getting dropped out.
Great. We will be happy to do that.
Thank you.
So right now of the 23 programs that were denied, you think about 11 to 14?
I think it was, yes, sir. It was between 11 and 14 that submitted data for an appeal.
And that appeal deadline is already passed?
It is, yeah. So no more can be submitted.
They can't submit, but they can submit additional information, and then staff is going to consider that.
Right.
And staff may, like last year, make a recommendation then to put them on the 2 or 4 year exemption list, which then would not have them have their full appeal before the board.
Right.
So in theory, the most we would see would be 14 folks at the board meeting in October.
Yes, sir.
But if it's like last year, you approved at the last minute on the second or third appeal, I guess, about half those.
I can't remember exactly how many, but there were a few. There were 3 or 4 that we approved.
The board granted the exceptions on about half the ones that came before the board.
Correct. About 11 out of the 21 were granted temporary exemptions.
Okay. Is the process that you used last year identical to this year's as far as the number of times that they can actually submit additional information, the number of times they can appeal, and ultimately it comes before the board at the October meeting?
Yes, sir.
Okay. From staff perspective, is that a reasonable timeline to get everybody talking to each other?
Yes, sir. It was a lot easier with 80 instead of 550.
Right. And my concern is that next year we're going to have maybe upwards of up to 182 programs coming up on their 2 years.
Well, sir, and I've kind of been spreading this message, and maybe you can reinforce it if you choose, but from my perspective, last year when the board granted temporary exemptions to those programs that chose to appeal, the board seemed very adamant that this was your one shot. And you need to come up to standard by the end of your 2-year period, and don't come back to us if you don't. And that's at least the initial stance that I'm looking at for those 2-year exemptions is you better have come up to standard or have a really good story as to why you didn't, because the purpose of the 2-year exemption was just that, to give them 2 years to come up to the standard that was set based upon the trend that they were showing, the number of students in the program, and improving their graduates. And if they're not able to do that in a 2-year period, then, from my perspective, they didn't fulfill their obligation for that 2-year exemption, and they're going to have a very high hurdle to get over to get a second one.
Yes, and so. And I missed that board meeting. That would have been my first last October. So do we have a rule that it's a one exemption only?
No, sir.
So the process will be, again, they can ask for an extension, and again, they can still come before the board?
Yes, sir.
And will that follow the same process throughout the entire year, or is that something that we can take care of before the spring of the year so that they know if they can or can't admit students for the following fall? It's my understanding that
accelerating the process would be difficult simply because of when the availability of the data comes in.
Okay.
So the first step that we take care of when new data comes in is to populate the accountability system.
Mm-hmm.
And so for our data staff purposes, that kind of takes us through to January. And then the second step is to do the low producing program report. And so that we get that at the beginning of February and provide that to the institutions. So condensing that, the review period, I think would be a fairly significant challenge to try and get that done quicker.
Your plan is to do it on a parallel track to all those that drop out next year.
Yes, sir.
With the theory that unless the standard changes, you're going to expect a number probably less than 80 because
correct.
You have a declining pool of marginal programs.
Right. And we hope that by that time, 180 are what is left of those 249 that received temporary exemptions who have not met the standard yet. And we hope that over the next year, those 180 programs achieve the standard for the 5-year period and drop off. And so we're hopeful that that's the case.
So the institutions that are in the 80 this year, let's just think about the cohort we've got going on shifting gears back to that, the 80, if they were to be denied a temporary extension, they would not be allowed to enter new additional students in that discipline as of the spring of next year.
Yes, sir.
So the decision in October is still timely.
Yes, sir.
Okay. So these folks that were told the initial no from the staff appealed, and second no from the staff appealed, now we're not told don't admit anybody this fall. They're still able to admit people into those programs.
Yes, sir.
Is there any concern that a 5-year window that you're looking at that as a measuring stick, but only allowing them a 2-year correction, that if they have a bad year 3, 4, 5 in that they're not going to be able to correct that in the 2 years?
Certainly the institutions have expressed concerns about that.
I think as a workout, we probably ought to have some type of a dialogue or discussion of what kind of metrics would be an exception that we would grant an additional 2 years. Because I know you are granting some 4, or we are granting some 4 years.
Right.
But those, our conversation was mostly that those had integrated programs.
Yes, sir. Those are where all the courses in the degree program are coming from another degree. And so there's no additional cost for operating that degree program.
Okay.
Thank you. I have another comment. I think this low-producing degree programs analysis has saved the state a lot of money, or eventually it will save money in 4 or 5 years. Can we do the same thing with the low-producing courses at different institutions? If less than 3 students take the course for 2 semesters, or less than 5 students take the course for less than 3 semesters, maybe we'll call those courses low-producing courses and recommend to the institutions that they should either cancel those courses, drop the courses, or maybe combine with some other courses, which may save a lot more money too.
Could we? I have to defer to legal as to whether the statutory authority is there. In terms of the mechanics of it, it becomes somewhat challenging in terms of being able to, one, identify those courses in a timely manner. I mean, you could potentially not fund courses that only did not meet whatever the threshold was. At present time, the threshold is for small class sizes is fewer than 6 at the graduate level and fewer than 10 students at the undergraduate level. So it really becomes a question of the institution's willingness to provide a faculty member to teach a course that is that small. Frequently, you will run into a situation where the option is either teach the course, or a student has to stick around for another semester, or you have to provide an alternative course for them to complete to finish their degree. And so there are situations where institutions feel very strongly that they have to be able to provide some small classes in order to meet the needs of their students. And again, I mean, it's possible, yes.
Can we do a pilot study on that so that you can report to the board in next board meeting that this is what we found and this is what we should do on these low-producing courses?
I want to challenge something that Durga just said, because it's contrary to what I understood. I think you said that closing these low degree granting programs has saved the state a lot of money. And it's my understanding that we're not able to show objectively a significant savings, and there's not studies out there showing that there's going to be a huge windfall to the state in education dollars by closing these. It's really for a variety of other reasons that we're closing these, mostly along the lines of efficiency and having larger pools of students at some institutions rather than lots of little pools.
I think in terms of efficiency, I think the institutions would be able to show some savings if they're no longer teaching multiple small class sizes, as Dr. Agarwal was saying. One of the key measures that we look at for low-producing programs to determine whether or not to grant a temporary exemption is whether or not 20% or more of their courses in that degree program are small class sizes. And if they are, if the 20% or more are small class sizes, then we're automatically looking at it going, okay, well, the expectation is that that's a low producing program, and it's going to be a high cost program because the cost of having the faculty teaching that few a number of students when they could be teaching more than 10 or more than 6 certainly could yield some cost savings.
Of course, they will save the space. They will save the faculty time. They don't have to hire additional faculty. The faculty can be moved to teach something else. Savings are there, but I don't know if we know how much savings they will have per degree program that we drop.
Right, but I guess my point is we're treating the symptoms and not the disease. The disease is too many small class sizes.
And I would argue the other direction. I would say that by closing the low-producing programs, it helps to eliminate the small class sizes, because typically you're going to see the small class sizes at the upper division of the discipline. And so it's because you only have 10 majors in a degree program and you're teaching 15 upper division hours, spreading those 10 students across those 5 classes is not going to mean that you're going to have 10 students in each of those classes, because they're on various cohorts. You may have 1 freshman, 2 sophomore, and so on. So they're not all going to be taking the same classes at the same time. And so by closing the low-producing program, you are eliminating a significant number of small class sizes in doing so. Now, it doesn't answer all the question, because there can be small class sizes for specialty courses that faculty choose to teach or institutions offer for a variety of reasons.
But the problem is, and one thing that hasn't been mentioned in this conversation, is there seems to be a presumption that the faculty may go away.
Yeah, I don't think it is.
In some cases, the faculty will remain. And so a lot depends on what the institution decides to do and what the program is. So if it's history faculty members actually are teaching quite a number of lower division courses to other students. So they may remain, and it may be they were teaching some small classes, but those faculty numbers, the number of faculty may stay the same. You don't know. In some cases, they could choose to reassign people to other departments. In fact, the university where I used to teach closed a couple departments, and they actually converted them to computer science faculty and provided training programs to do that. And that was very productive in that case. But there were other faculty who left the institution. It was a private university, so that they were very budget conscious. But a lot of this depends on how the individual institution chooses to approach this and what really is the program. And McGregor's staff could tell you more than anyone that the range of programs they've looked at in those 500 programs is immense. And there's some flavor that was a little different in each case. So there can be potential savings. I think the savings are much likely to be further out than near term. And a lot of that depends on the management of the institution and how they decide to approach the program. And that's why it's really, for me, and I had mentioned this earlier in a conversation, that for me, one of the biggest issues is really the quality, and that's, I think, what you're referencing, Dr. Tischer, is right. that when you've got a small number of students, they're missing the opportunity to work with other students. And you could have great faculty, you could have fine faculty, but it's really helpful to have the other students as well. So long-term costs, I think, can be a factor. Near term, I think it's less likely to happen, simply because you've got the teach out, as McGregor was talking about, and there are a number of factors where the short-term savings aren't going to be quite as evident. You will not see the small classes, though. They will disappear eventually.
Well, the small classes could disappear and still retain the program if you allow collaborative agreements and distance learning. And that's what I'm talking about, the disease. The disease is small class sizes. Right. And using resources when divided by the number of students as your denominator, you're using considerably more per student contact hour of resource, whereas we now have the electronic ability to disseminate classroom learning anywhere in the world.
And I think
if we had every one of those upper division courses available at one institution, anyone else could close that small class size down and say, we're going to collaborate with these guys. You're going to do it on that way.
The Virtual College of Texas,
Virtual
that the
College
community
of
colleges
Texas
use
is already doing
is a
that.
great example of how the community colleges have found a way, not where there's necessarily a missing program, but a way to provide a class that they can't provide at the other institution.
And it works, and it's working very well.
Worked very well, and they've learned how to share those costs through the formula in a way that makes sense. So that's sort of the beginning of a model that could be used at another level as well. And I think, there are ways to benefit from that. And I think there are people at institutions that could have good ideas. You asked North Texas earlier about whether they do online. They do a dramatic amount of online compared to many of our institutions. We have institutions out there that are working on some of these things, and we need to capitalize on their knowledge and build on it.
Can I just give a quick example of what I've seen actually happen at a community college level? It's exactly what you said through the Virtual College of Texas. For instance, Panola College, we don't have enough students to offer full-time or to hire a full-time physics instructor, but we always have 3 or 4 students that need physics. But we collaborate with Kilgore College, and by combining their 4 or 5 students with our 6 or 7 students, we can put together 10 students, which we've always said that in order to make a class, you're going to have at least 10 students. And then we meet those needs of those students in both institutions by, like David said, working in a collaborative manner. So the Virtual College of Texas, I think, is a wonderful example. I don't know whether we have anything similar to that for 4-year institutions. I don't think so. But it's certainly something that could be looked at in order to meet the needs of the students at different institutions.
So when we discussed this at the last meeting, I understood from Dr. Paredes that an institution that was shuttered could recreate itself and come back here and apply almost immediately. But in reading the rules, we've adopted a 10-year death penalty. Is that true? Or did I misunderstand what Dr. Paredes...
More like a 10-year hard call. I mean, it's not really a death penalty in that what we set out was that they could not be automatically approved for a new degree program in that zip code, but they would have to go through the full application process so that it would come through and they would have to fully justify the new degree program.
So they would not be on the expedited program.
Exactly.
They'd have to come through the board.
Correct. And so, and we have had one come back that was within the same zip code that we, at the staff level, turned down. That was very, very similar in terms of a program that was closed for low producing. But it's not a moratorium. They're not foreclosed from ever having anything in that area. And the reason being that the industry may change, the local community may change, workforce demand may change, and there may be opportunities for the institution that come up that we can't really foretell well enough to say, no, it can never happen within 10 years. We've just tried to make it clear that it's not going to be an easy route.
Thank you. Any other comments, or should we move on to other next agenda item? Next agenda item is 5J, is to update on the reallocation of unspent program year 2011 through 2012 Carl D. Perkins Career and Technical Education Improvement Act funds for use in program year 2012. And McGregor will again make the...
Thank you, sir. This is just kind of an informational item for you all to know that we have $1.7 million that we had set aside from unallocated Perkins leadership funds because we were afraid that with the federal budget being what it was, that it could result in significant cuts. And we didn't want to have to pull money back from the institutions if a cut did come into place. So we held these funds back enough to cover what we anticipated to be costs or cuts. Those cuts never materialized. And so we are going to reallocate these funds rather than trying to do new leadership grants. We're simply going to reallocate these back through the traditional formula funding for basic Perkins. And so the institutions will get this $1.7 million allocated through the traditional method. And we just wanted to let you all know that those held back funds were not needed.
Thank you. Any questions? Next agenda item is 5K. This is presentation of the results of evaluation of the developmental education demonstration project conducted by Public Policy Research Institute at Texas A&M. Dr. Jim Dyer, Dr. Nandita Chowdhury, and Dr. Eric Booth from the Public Policy Research Institute will present the evaluation results of the developmental education demonstration project. Thank you, Dr. Dyer, Dr. Chowdhury, and Dr. Booth. Eric is.
Good afternoon. Thank you to the board for giving us some time to talk about the results of our evaluation of the Developmental Education Demonstration Project. And so we have about 3 slides here. We're going to talk about the project and the major findings and recommendations for the board. First slide, please. The evaluation of the DEDP sites involved us going on site visits to all of the 5 community colleges and 4 universities you see there on your slide. And at each site, we did at least or up to 2 site visits, and also did focus groups, interviews, surveys, and other types of quantitative and qualitative data collection in order to get an idea about what types of things are working at these sites. So we went to Lone Star Community College, Tarrant County Community College, Alamo Community College, El Paso Community College, and San Jacinto Community College. And then for universities, we went to UT Pan Am, UT Austin, Texas State, and A&M Commerce. And the study findings in the report, which we don't present all of today, it's a pretty extensive report, were really focused around these 4 main areas. And so to give you a little bit of context before we tell you the recommendations today on the next slide, we wanted to give you a really brief overview of the main areas in which the report was organized. So really the things that were working and not working at these different sites for the DEDP program are organized around curriculum design and instructional strategies, institutional supports and resources, professional development, and student supports. And so to reify these 4 points a little more concretely, the course options finding really talks a lot about how the sites used a lot of different variety of course options in order to help improve some of the outcomes for these DE students, including blended and paired courses, self-paced courses, and accelerated courses. And so some of the successes came out especially for the paired courses like the integrated reading and writing courses that were offered, or the accelerated courses where students could move more quickly, especially students who learned in a certain way could move more quickly to credit-bearing classes. For institutional supports and resources, the types of resources that were offered to help DE students to better persist and make it through DE classes, there's a variety of different strategies, again, that the institutions use, but one that stands out is the monitoring systems that were used at some of the institutions, where sometimes they're called early alert systems, where they monitor where some of these students were having trouble with, let's say, attendance or passing certain types of progress exams, or not, making certain grades in their classes. And they were actually able to alert not only the instructor but the advisors, and also some special advisors that were there to provide targeted workshops for these students. So if they needed help with study skills, time management skills, and things like that, to keep these kids in class, students in class, and progressing in class. In professional development, increasing professional development, of course, is something that can be useful for DE instructors. But one thing it really also helped was the collaborations among faculty and between faculty and administration. So the degree of collaboration and communication that occurred around the professional development activities, the targeted DE professional development activities, were seen as a big success across most of these institutions, and really increased that second bullet point of institutional support and buy-in for many of the subcomponents to these programs. And then finally, when it comes to student supports, again, one that really sticks out are the supports that were added to these programs to help get students into appropriate tutoring, advisory, and mentoring, so that they were getting reinforcement about the ideas learned in class, and also some more relevant skill sets built in for like project-based learning and learning how to apply the skills they learned in class to real-world events and things like that. Next slide, please. And so out of this context of things that were working and not working for various colleges and universities, we had a set of recommendations that are detailed extensively in the report. We can't cover all the 15 to 20 recommendations here. But in the few minutes we have, I just wanted to briefly go through some of the recommendations. We have them really organized around pre-implementation, during implementation, and post-implementation, because for these types of programs and whatever this program looks like going into the future, if it comes about again, the challenges that these programs faced were really sort of separated in those three different phases: planning ahead of time, planning during, or operating during the implementation, and then what they did at the end of the program in order to learn how to sustain or better implement these components in the future. So with pre-implementation, the first bullet here is about stakeholder involvement. And the challenge here was that several stakeholders, and we say stakeholders here, we mean instructors, administrators, advisors, counselors, really didn't feel integrated with the goals and the strategies going on in the DE program at the university. And so the report talks a lot about ways to enhance stakeholder involvement so that they could actually be connected to the DE program and know what's going on and what those students need. And then also that applies for community partners like the local ISDs that might be sites where they're doing some of the THEA testing and things like that. So better bringing all that into the same fold. Another challenge was that with the DEDP program, every site sort of implemented what made sense to their site, which increased flexibility, but also meant there were a lot of different program elements and the policies that go along with those. And so our recommendations in this part of the report talk about sort of honing in on the program elements that were successful and that had and evidence-based program elements and the policies that go along with that, so that we could, or so that the programs could concentrate on, strategies that seem to be working. The next bullet talks about the challenge where DE on a lot of these campuses was not aligned with other programs that may be doing similar things or dealing with similar student populations. For example, the adult basic education and English as a second language courses and programs. And so efforts, for efforts to be put in place so that DE was working with those personnel and those programs more closely. Another challenge that the sites faced were really about knowing how to, transition to the THEA test. And we know there's another placement test that's coming about, but there were a lot of challenges around sites about how the logistics of the placement test, and so we talk a lot about that transition and what kind of challenges it faced for the site. I've already mentioned having DE-focused faculties and advisors. One way that some sites were able to do that is to have actual DE certification programs, like the one at Texas State, right? That where they could actually become certified in DE and learn some of the skills to work with that population of students. And then the last pre-implementation suggestion we talk about are about the internal evaluation measures. In terms of the sites not really, in this go-round, they really didn't collect the data and operationalize the data in a way where we could really leverage it into, a close comparison of the different strategies and what was working and what wasn't. And so defining from the outset how the site should try to collect some data and define some data to better get, to be able to evaluate these programs. And actually there's one more thing, and that's sustainability. A lot of these sites weren't really thinking about sustainability from the outset, or where they were thinking more about sustainability of, say, people, not functions. And so a challenge there is that when they get to the end of the program, the ability of various components that are working to stick around is diminished if they haven't really thought about sustainability from the outset. In terms of recommendations around the implementation, while implementation is going on, We talk a lot about connecting, advising more centrally, and advising faculty more centrally to the assessment and the placement and the instructors. And a lot of that is about how advisors weren't DE specific or weren't really collaborating with or even physically or geographically located in a way where they were even being sort of integrated as part of the DE program. And so in a lot of ways they were disconnected. And what that meant was that students weren't getting consistent information between advisors and the courses. They were sometimes seeing those as barriers that some instructors and administrators thought led to students getting frustrated, possibly dropping out or not coming back to class or knowing what requirements they needed to have. And so better connecting those entities and the information that goes among them we thought would be a big place where we could capture those students that were sort of on the margin of being able to stay in these programs and move on towards credit-bearing classes. And then another point in that middle section there is about the coordination with similar grants. What we'll say there is that there are other grants going on at these universities and colleges, but they sort of acted in silo, where they could have benefited from collaborations they were doing similar strategies or had similar personnel that could have been working together. A lot of times that wasn't happening. They weren't sharing results and things they learned. There wasn't a sort of internal feedback loop there, and so we had some suggestions in the report about sharing information and sharing possibly working together at some of these sites. The last point there also about grantee outcome sharing, and here what we talk about is sites really were eager to hear what other sites were doing in real time and having a mechanism where they could get data and other information about best practices and what's working at their site reported in a transparent way where they can see what's going on. There are some things like conferences and things like that, but they wanted something more real time for that feedback loop. And then the last section on post-implementation recommendations really are sort of summed up in that first bullet point, which is of the things that we saw that tended to be successful across these colleges and universities, there needs to be an effort to institutionalize those successful elements, not just see them as a temporary Band-Aid that they do for the 1.5, 2-year period of the grant, and then they'll go back to normal, but really change policies and put things into place that kind of institutionalize those success elements so they can be sustained and so they can have long-term effects where they're working. And so we talk a lot about ways, suggestions about doing that. And those are the most of the recommendations we have in the report. Again, there's a lot more there, but we'd be happy to talk about or answer any questions you might have.
Any questions? Gentlemen, thank you very much.
Thank you. Thank you. Thank you so much.
Now we'll move on to next agenda item. 5L1 through 3 regarding proposed rules. Agenda item 5L1 is consideration of adopting the Commissioner's recommendation to the committee relating to proposed amendments Chapter 4, Subchapter C, Section 4.53, 54, 55, 58, 59, 4. And 4.6, a board rules concerning the Texas Success Initiative. Dr. Judy Loredo will be providing the details.
These were the rules that you had in your document that relate to the TSI initiative. These rules were reviewed and vetted with the DevEd Advisory Committee, so there was stakeholder input. And in reference to what was just talked about with evaluation, these rules help give that teeth or that meat to the importance for what institutions need to follow through in terms of that success initiative. The rules were posted for 30 days, and we did not have any comments. We did not receive any comments within that 30-day required response period. So the rules are being presented to you for approval.
Any questions for Dr. Loredo?
Move approval.
Second.
Motion has been made and seconded. All in favor, say aye.
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 Those opposed, same sign. Motion carries. Next agenda item is 5L2, that was on consent calendar. Agenda item 5L3 is consideration of adopting the Commissioner's recommendation to the committee relating to proposed amendments to Chapter 4, rules applying to all public institutions of higher education in Texas. Subchapter Chapter R, review of low-producing degree programs, sections 4.287 and 4.291 of board rules concerning definitions and processes for requesting a temporary exemption. And McRae will explain this. We had a long discussion on this just now.
Yes, sir. And this is the increase in the low-producing standards that we briefly touched on earlier. As the board had requested, we looked at raising the standard from our current level of 2 graduates per year over 5 years at the doctoral level, 3 per year over 5 years at the master's, and 5 per year over 5 years for the baccalaureate and associate level. What we are proposing is to raise those standards to 3 graduates per year over 5 years at the doctoral, 5 at the master's, and 8 at the baccalaureate and associate level. If you will turn in the documents that we've provided to page 4, you can see in the chart 4, 5, and 6, you'll see in the chart, or 4 and 5, you'll see what the other states that do have statewide standards for low productivity. And as you can see, only the 19 here do have statewide standards. The rest do not. With the 3, 5, and 8, we're kind of hitting a bit of a middle ground. We felt that we weren't at the highest level for baccalaureate degrees and associate's degrees, which is 10 per year at a number of different states. We were at 8. At the master's level, at 5, we were certainly toward the upper end, and that 5 seemed to be about the highest level at the master's level. At the doctoral level, 3 was, again, about the highest that we saw. But we felt like that those were valid increases from the current level. That going from 2 to 3 we felt like was the most that we would feel comfortable recommending to the board. Going from 3 to 5 at the master's level was the greatest amount, and going from 5 to 8 at the baccalaureate and associate level, we felt like based upon the time to implementation, that these provided the institutions with sufficient time to ramp up their programs, to focus efforts on recruiting and retention, and ultimately graduating more students. The proposal would provide that this would not come into place until the review in February of 2018. So we're a little under 6 years out. As you brought up earlier, Dr. Tischer, this provides the full time period in which, or almost the full time period in which the institutions can impact their recruitment and retention strategies for these degree programs. So it's not going to be a surprise to anyone that these are the standards that are being set. We had originally proposed these in April and withdrew them so that we would have an opportunity to discuss with UEAC and GEAC their thoughts and concerns or recommendations for these programs. And Dr. Agnes DeFranco is here from the Undergraduate Education Advisory Committee. She serves as one of the co-chairs. And if it's all right with you, I'd like to have her come forward and present the discussion that was had at UEAC and how their recommendations differed from ours. Thank you.
Thank you. As Dr. Stevenson said, he asked us to come over here to the meeting about how we deliberated.
Agnes, would you mind turning on the mic? The little light should come.
Okay, this works.
There you go.
Perfect, thank you. At the March 30th, 2012 meeting, one of our agenda items was to discuss the load producing program. And the coordinating board staff proposed the increased level, as Dr. Stevenson said, from the 235 to the 358, and have the implementation period to begin in 2017. And this means that the 5-year reporting period will start at 2013 to 2017. In other words, the students entering this current fall semester will be the first group that will be counted into this new threshold. As the staff mentioned this to us and shared a proposal with the committee, our committee members have a number of questions. For instance, that some of them asked, was there analysis done after the first year to see if this will actually save money and how much money will we save for the consolidation of the programs or closing out some programs? There are also some issues that talks about the access, especially with how Texas is with our geographical dispersion, regional university versus universities that are in concentrated population areas. There are also questions about programs like physics and mathematics, which you all have just talked about already, that they are the programs that will generate very small number of majors, but at the same time they serve a lot of foundational courses and so on. And in particular for mathematics, physics, and science courses, these also help in preparing our high school teachers too. The UEAC members, we do understand the need of streamlining the programs to be offered and also weighted and balancing the costs that everybody have to bear. It's not just the cost that the state has to bear, but the institutions have to bear, and most importantly, our students have to bear. So we broke into groups, we discussed, we come back, we deliberated as the whole committee. We look at all the pros and cons, and at the very end, we came up with a motion. And actually, we had two, but the first motion failed due to no second. So the second motion was passed with 7 ayes, 3 nays, and 2 abstentions, and it reads as follows: that the threshold should be established in spring 2014 and implemented beginning in fiscal year 2019. A committee or task force should spend the next 2 years studying the effects of the fiscal 11 and fiscal 12 load-producing process in order to determine the appropriate threshold levels and rules regarding exemptions. Thank you.
Thank you very much.
Thank you, Dr. Morales. Thank you.
As you can see, I'm sorry.
Wait, and I'm going to let you finish your remarks, but I'll have a question for you.
Sure. As you can see, there is a variation between what the staff have recommended based upon the board's instruction and what the UEAC committee recommended. The GEAC, the Graduate Education Advisory Committee, also made a similar recommendation to delay any further increases, and a representative from GEAC will be here for the board meeting, but was not able to be here for this meeting. What we have brought together is our recommendations. You can also see in the supplementary materials a number of comments that were raised, and the most predominant number focused on looking at justifications for temporary exemptions for degree programs based upon, as Dr. DeFranco indicated, geographic proximity, distance to a degree program of comparable discipline, the cost of having the degree instead of eliminating it. A number of those common issues were raised in these comments. And so we do intend over the next couple of years, once we get the standards set, to work with UEAC and GEAC to identify and try and develop metrics to evaluate those type of temporary exemptions that would be granted under the proposed rules and under the existing rules, so that we have a better understanding of what they feel like the most important metrics are in evaluating those programs, and also have a more, hopefully more objective evaluation that can be done when we raise the standards. And so that's kind of the way that we presented it to UEAC and to GEAC, that we did want to continue working with them on specifics for temporary exemptions, but that we were going to move forward with the recommendations for increasing the standards.
Yeah, I had a question for you. As you looked at these standards, are you aware of any objective measures which indicate that there is a large cost savings in any of the studies for closure of these type of programs?
No, because we don't have the data for that. And I think you all have mentioned it earlier, too, in your discussion, that some of these cost savings may not be realized until much later, too. And it may be a faculty member be reassigned to another department, which the cost is still the same. But again, things may not be easily measurable just 1 year or 2 year out. So we don't have that data either.
You didn't have a unanimous vote of your council. What were the dissenting votes? What was their opinion when you took your vote?
Again, there were the questions that we all raised earlier. The access, the proximity, the STEM majors especially, certain majors that are low producing, but yet again, they provide a lot of foundational courses for everybody to take. Again, it's just the numbers that just came out and saying it from 235 to 358, but we don't have any data yet as far as if we are saving money or not, and can we wait a little bit more. I do not believe that the groups, when they look at the numbers, they were against the numbers as much as they want to have a bit more time to look at especially exemptions too. Again, everything that you all talked about earlier was the things that we talked about at our meeting, the 2-year exemptions versus 4-year exemptions and things of that nature.
Did they mention anything about the quality of the faculty that may be in these programs, the productivity of the faculty as far as writing, publications, research, grants?
And thank you. They did mention that there was a discussion about if we have teachers or professors just teaching lower level classes and they're not able to teach the upper level classes because there are no majors in those classes, then perhaps the quality of the faculty that will be able to attract into Texas or retain in our institutions might, be different.
And
so there was a discussion with that.
And have you ever seen any research that supports that?
Personally, I have not. So that was something that was brought up.
So it was brought up as anecdotal, that the thought would be this would be the ramifications if they were not able to teach and publish at the higher division level.
Could be because they're thinking that, if you don't have the courses that they can teach at a higher level and all their teaching is the first, 2-level classes, then they might be able to do more research elsewhere.
So this is really a top-down approach, and we're actually making a much higher standard. We're putting it out there a number of years out there. Do you think that there is a understanding within the higher education community that we're expecting them to move in a direction to be more efficient? Absolutely. And are there opportunities to collaborate like we saw with UT Dallas and UT Arlington?
Absolutely.
Do you think that the higher education community is going to move in those directions with us giving them a top-down approach or without? Or do we really need to institute something that may be punitive or harmful to some of these institutions?
No, and actually you've seen it today already, and Dr. Gardner also mentioned it too, that many universities are doing collaborations already to make sure that we are using our resources as effectively and efficiently as possible. So we are doing that already.
Thank you, Doctor.
Thank you.
Any other questions? Dr. Sujanan Morales Vale, thank you very much, ma'am.
Thank you.
If there are no other questions, I need a motion.
So move.
Motion.
So move.
Made. Do I have a second? Yeah.
No, I'm not going to second it.
You can second it.
I can speak to it.
I second it. And those in favor?
Can we speak to it?
Yeah.
I think the staff has done a lot of work on this. I appreciate their work. I appreciate their opinion. I believe this is an arbitrary standard. It has not been tried. It has not been tested. The arbitrary standard that we've already have in place has barely been implemented. We've closed hundreds of programs already. We don't know the potential for harm or good in those closures. I believe the vast majority of those programs probably should have been closed, and I believe that the vast majority of our job in this top-down type of approach is already taking place. I believe an arbitrary one-size-fits-all standard is not healthy. It's certainly not healthy, I don't believe, for our regional universities. I think it will have a very harmful effect, and that's where we close the gap. We close the gap in our regional universities in some of these programs. The harm that's going to be done is extensive. You're looking at 677 additional programs to be closed using this year's standards. So if nothing changes, you're talking about the better part of 677 different degree granting programs being closed. And I don't know what the results of those are because of the premature nature we are here adopting this. I think we should put a moratorium on this adoption. I think we should wait another year and get input from the educators that have been affected by the programs, by the students who have been affected by the programs that we've already closed or that will be closed, almost 182 probably next year, that will get to the end of their 2-year exemption. So I will be voting against this and speak against it.
I will request Bill to tell us what to do. We have a motion and second, and motion carries. So what do you think we should do, Bill?
You refer it to the board.
You take a vote.
Final approval.
Yeah.
You take a vote.
Yes, that.
So it goes to the board for final approval?
Yes,
you have to take a vote.
Yeah, just call for a vote.
Dr. Agrawal, if I may, the vote should be taken at this point. It would then move to the board for another vote in about a month, and that would be the appropriate procedure.
So I ask for a vote again. Aye. So 2-1, motion carries.
Can I vote?
Yeah.
I vote nay.
Move on to the next item.
If I may, before we go to the next item, I would like to take this opportunity to thank my staff members that worked on those 2 reports that we had. On the dental study, Elizabeth Mayer, Chris Fowler, and Alan Mickey put that together for us. And on the transfer study, Catherine Parsoneau and Rebecca Leslie and James Goman worked on that one. So I would like to thank them. So thank you very much, Mr. Chairman, members.
Thank you. Thank you very much. So next agenda item is 5M, is consideration of adopting the staff recommendation to the committee relating to the P16 College Readiness and Success Strategic Action Plan Progress Report. Dr. Judith Loredo will be presenting this item.
Thank you, Mr. Chairman. This is a report that we are required to do every 2 years in conjunction with TEA. It is a report that has addressed our work of the P16 initiative over the last years. This report is due December the 1st. This report was compiled and documented with the work we have been doing, both collaboratively with us as an agency and with TEA. So the report presented to you is a joint report of both agencies, and we are asking approval. It's an information report that must be submitted to the legislature and the governor every 2 years.
Move approval.
Second.
Motion made. All in favor?
Aye.
Aye.
Those opposed, same sign. Motion carries. Next agenda item is 5N, is consideration of adopting staff recommendation to committee relating to use of federal fiscal year 2012 teacher quality grant funds to extend current grants and provide funding to support the continuation activities. Elizabeth Powers, Director of Teacher Quality Grants, and Dr. Judith Loredo, Assistant Commissioner of Division of P16 Initiative, will present this item.
Thank you, Mr. Chairman. In this item, in your blue page in the back, you have a list of institutions that were previously approved by you for funding to receive teacher quality grant funds for fiscal year 12 and 13. We are coming to you at this time to ask that we be allowed to, based on evaluation, based on submission of a proposed plan, with external evaluators reviewing the plan, to be allowed to extend their grants for another year through April of 14. We have $4.9 million with which to do this. It is in statute and is allowable. Our reason for wanting to do it in this manner and not go out and seek brand new grants is that it takes more than 1 year to impact change in a classroom and that professional development of teachers. With the results that we have got preliminarily on STAR exam in the math and science areas, it would behoove us to allow these grants to continue that are doing well and are showing promise in that teacher performance, their change in behavior for delivery of math and science. And so that's why we come to you today to ask that we be allowed to continue those that are currently funded. And as I indicated previously, it will be based on evaluation, it will be based on a proposal, and it will be based on external evaluation, deeming how much they should receive and whether or not they should receive continuation funds. And you've got the list of the schools that are involved and the amount of money that they're currently receiving.
Any questions?
So the question I have is, obviously, this is other people's money. It's idea here would be, in your mind, if we had to spend our money, i.e. state funds, would we consider this project a high enough priority that we would dedicate those funds to that?
Yes. My reason for responding yes, it's in a critical academic area of math and science, which also leads in terms of students that we're hoping to want to consider these disciplines later as their own career choices. We have the critical need to strengthen the delivery of this content area in the elementary grades, middle school grades, etc. And it's really a teamed effort between the university world and the public school world. So it's not just teachers in the public school world retooling themselves. It's the joint effort of what we're even doing in higher ed in our own STEM areas, and also in relationship when you think of our faculty academies that we focused on the critical areas of the career college readiness standards. Those standards are what are also impacting this training. And so it's a critical need. We need to continue this, and we have no assurance that there will be money even after this funding of money that we have because it's not been reauthorized. So because these institutions that we have awarded the money with are highly evaluated, there's a very rigid evaluation process to see that we are impacting change. It would behoove us to give them the additional year to keep this momentum going, instead of just starting with a brand new, fresh group of institutions that are going to end in 1 year.
Thank you. I move approval.
Second.
Motion has been made and seconded. All in favor, please say aye.
Aye.
Aye. Those opposed, same sign. Motion carries. Next agenda item is 5O. It is consideration of adopting the staff recommendation to the committee relating to the statewide developmental education plan, SB 162, 82nd Texas Legislature regular session.
Mr. Chairman, if I might begin before Dr. Morales Vail does, who is our Director of DevEd and Adult Basic Education. I have asked her to make this presentation. I wanted her, who has been the lead with her staff. I would like to commend her staff, herself, Terry Daniels, Dr. Linda Munoz, who is the Director of Adult Basic Education, Lynette Heckman, and the advisory board that has worked, the DevEd advisory board, along with the researchers, the research team that worked with us in putting these reports together. These are 4 required reports you're going to hear that must be submitted by December the 1st to the legislature. But before she begins, I just want to make a few introductory remarks. In the reports that you have before you, those specific reports, there are some changes that we made to the executive summaries. Did you pass them out to him? Yes. Dr. Morales Vail passed out to you the copies of where the corrections are noted so that you could see where we made changes. We did not make any substantial changes to the documents. After meeting with the commissioner and Dr. Gardner, he had some concerns in that when you submit these documents to the legislature, the governor's office, they may not take the time to read the entire document page by page, and so that they're looking at the summary to be able to get a good solid grasp of what follows within the full document. So we went back and we added some things where the commissioner, Dr. Gardner, raised some questions in terms of not understanding a term, and so as indicated, the documents have not changed. We just added some information to the beginning part of the executive summaries.
So can we clarify something? I've got a document, this is 9/17/2012, and it's not a markup copy, which would be predated by what was just handed to me as 9/5/12. Which document am I to use, the 9/5 or the 9/17?
9/17.
It's the 9/17.
Yes, that is a document that you are to use, but we handed you the past one so you could see where we might have made some changes.
So the 9/5 is the old document?
Old one, it's the old one.
Okay, I see.
Yeah, so
okay.
but I didn't know if you would want to, at your leisure, to go back and see where we pulled the other stuff out or what comments were made that led us to make the changes. And so we wanted you to have both of those so that you've got a clean one, the 17th. That is the one that will be going out after External Relations has reviewed it as well. The staff worked on these, countless of hours, because we did not want to wait and get it to you in October when the whole board saw it. We wanted you to be able to see it before it then will go to the entire board, and then doesn't go forwarded to the legislature or the governor until the 1st of December. And I think one of them is January 1st. So
was the copy you have that is marked 9/17, was that also one that was posted on the website?
I think
that I had in our prep material? So I've already read this.
Yes, it's the same document.
Okay.
Yeah. Dr. Morales-Vail is going to present them to you, and she will give you a choice in terms of how you want them presented so that we can briefly go through those recommendations. What you heard in the evaluation from the team from A&M is what has informed the documents and all the work that the DevEd Advisory Board Committee has done and the 3 research institutions that have worked with us. So that is what has informed the work that is in these documents.
Thank you. Good afternoon, committee members. Agenda items O, P, Q, and R request approval of 4 reports. All 4 reports are based on the Senate Bill 162 statewide DevEd plan, which is the first agenda item, the one we're addressing right now, agenda item O. And all of the 4 reports are interconnected to the plan's vision, goals, and objectives. So my question is, would you prefer that I present these related plans together, or would you like to have them be presented separately?
Together.
Okay, great. Okay, we'll begin with Senate Bill 162. And before I begin with this, I would also like to thank the DevEd Advisory Committee that addressed and provided a number of recommendations and some very insightful feedback. And we certainly are appreciative of their hard work as we formed and as we wrote these plans. So beginning with Senate Bill 162, as you can see in the slide, you could see that the charge is basically to develop a statewide developmental education plan. Now, we did have a previous plan from 2009, and we used that plan as a basis for this new 2012-2017 version. And as Dr. Laredo just mentioned, the plan is based on findings from funded initiatives, and you can see that included these lists. And in the actual report on page 6, you'll see a more comprehensive list of those funded projects. The vision statement is the core of the plan, and the entire plan is guided by that vision statement. 3 components of the vision statement I'd like to just briefly highlight: reliable diagnostic assessment, comprehensive support services, and non-traditional interventions for underprepared students. The plan also has 9 goals and 31 objectives to support and realize this vision. The bill also charged the coordinating board to study assignment of primary responsibility to 2-year colleges and to require institutions to use technology. So you can see I specifically focused on goals 1 and 2 and actually copied and pasted those goals in here to show how we are addressing those. Goals 3 through 9, I've just provided a short overview, and of course you can see the specific details and rationale behind each of those goals and their accompanying objectives in the actual plan. In addressing the goals, the following promising practices will be scaled. And this is where you can really see the interconnectedness among the plans. You can see all of these main components are detailed more specifically in the Rider 52 report. Specifically, the first three, assessment and placement, advising, and accelerated instructional strategies, are addressed also in House Bill 3468 report. And if you look a little bit down under accelerated instructional strategies, the non-course competency-based option is specifically addressed in more details in the Rider 34 report. So you can see that these are all promising practices that, based on the research, you can see reiterated by the findings from the earlier presentation from the Public Policy Research Institute, where the state is going in terms of developmental education. The report also addresses 5 main recommendations for the legislature to consider, and you can see these are enumerated up there as well, briefly talking about scaling the acceleration, addressing professional development. Important to provide the necessary time and opportunities for institutions to implement. Partnerships among developmental and adult basic education, and working on providing incorporation of the data that we're going to be needing as we further align developmental and adult education. Of course, it is important to note that in order to operationalize the goals and objectives of the plan, we want to emphasize that the coordinating board will continue to work with the Developmental Education Advisory Committee and other important stakeholders to help determine how to most efficiently and effectively make this plan happen. House Bill 3468 addresses mostly college readiness and placement improvements and recommendations, as noted by the title. The charge actually was to address diagnostic reliability, differentiated placements, DE funding formulas, and the non-applicability, also known as the exemption categories in Section R. So these exemption categories do not address the ACT, SAT, or end of course, but they do address the military exemptions and the prior academic coursework types of exemptions. Based on the study done by the coordinating board, the following recommendations were made. We have 5 recommendations here that you can see on this slide. And again, I just want to reemphasize recommendation 3 only relates to Section R, which is the military exemptions, and not the ACT or the other nationally normed tests. Finally, Riders 34 and 52. Again, as I mentioned earlier, Rider 34 focuses on the non-course competency-based developmental education options. And it talked to, we addressed a 3-part strategy to continue to support this strategy, which we believe is going to be very useful in helping us meet our vision and our performance measures. And Rider 52 is, back from slide 4, I believe it was, it has all of the recommendations from the PPR findings and other findings from the other initiatives. And these are the ones that are more specifically described in Rider 34 report. Are there any questions or comments?
Our charge, members of the committee, over the past 2 years with the funding of the demo sites that we call our 5 community college systems that were funded and our 4 universities, was to take the original plan and to address those items as identified in the plan to be implemented, which was the assessment, the advising, the rescaling or the retooling of curriculum, et cetera, professional development. And so over the last 2 years, that is where our work has focused. The evaluation has now given us some results. And at our meeting in June, you approved the combination of the funding that we have left to fund projects this fall, which we are getting ready to move into that process, to scale what we have learned that is working, so that we can now move this into medium-sized and smaller institutions. In the next coming months, we will be coming back to you with additional rules that will put this into place for institutions as we move forward. That is why one of the issues or recommendations is to take the time to keep moving this forward. I think the legislature will be happy in that we have found some things that are working and that are moving a needle. And so that's why these reports all now come together to put all that in place so that we can move forward to the next phase.
Any questions? Should I take a vote on all three items together, three agenda items, or each one separately? Yeah. Bill?
We have 4 items. Can we vote on them together?
And so long as there's consensus among the board members.
So
I move approval of all 4 items.
I second.
all those in favor, please say aye.
Aye.
Those opposed, same sign. Motion carries. Motions carries.
I'd like to make a comment. An observation from someone who's been around a while, and this is the first session of this new committee. I think if you look at the agenda items, not only is it a new committee, but I think you can see that there's the emergence of some new directions. I mean, if you think about the nursing program you approved, the joint PhD program, the outcomes-based funding, the DMP, I think you're beginning to see that the board, the institutions, and the staff are beginning to work towards some emerging models, and some of your discussions, I think, indicate that you're wanting to take that even further. So I just wanted to hope you had noticed that, but there's some very different kind of programs and things that you were approving today.
Thank you, Dr. Carter.
Everything started getting better when Munir was.
I wanted to note.
Talk about him since he's not here.
I wanted to note also, because I know that Linda Battles and the executive officers, along with, I guess, Mr. Heldersfeld, probably went into a lot of quandaries of how these committees would come together. But I know it was not difficult for us as a staff or a division when Dr. Stevenson and I were teamed up, to put the agenda together. I just envisioned it might be a nightmare, but it really wasn't. It flowed quite easily. So I just thought I'd add that.
Judy, thank you very much. And now we come to our last agenda item, and this concludes our meeting. And I would like to entertain a motion for adjournment.
I'd like to make one brief comment. Mr. Chairman, you've done a great job in expediting this meeting today as in the absence of our normal chairman. So I would like to make a motion that we adjourn.
Thank you.
Second.
Motion has been made and seconded. All in favor, say aye.
Aye.
And we are ready to go home. Thank you.
Absolutely.